Hello everyone, my name is Bimal Maharzan. I'm founder of Guts Fair and a survivor of chronic constipation, now advocating for GI health. Welcome back to our series or masterclass in battling chronic constipation, where I am sharing my experience of battling chronic constipation, how I became scientist of my own body, and now helping other chronic constipation patients to shorten the path of recovery. As my mom used to always say that as a patient, you need to know more about the disease than your doctor. And obviously, while navigating the US healthcare system, we have to fight like an MMA fighter and advocate, be assertive about the care that we deserve to shorten our path. So, in this episode, we are going to talk about biomarkers, we're going to talk about home test and clinical test. Because as we know that chronic constipation can be a multi-variable condition, multifunction condition, and many things can impact that chronic constipation. So, in this episode, we want to be able to talk about everything that you need to understand and diagnose your correct root cause so that you can shorten the path of recovery. Here is a quick overview of this episode. Number one is we are going to talk about the role of biomarkers in personalizing GI care. So we are going to talk about 7 different biomarkers, such as monitoring biomarkers, diagnostic biomarkers, and so on. And second section chapter we have is at home test. You know, as chronic constipation patients, our journey begins way before we visit our clinicians or doctors. So going to talk about 15 different tests which can help us to get some indicative idea about whether it's diet is causing, whether our lifestyle is causing, whether our structural issues, whether neurological issues and physiological issues, pelvic floor dysfunctions, and so on. So we are going to talk about those 15 different tests. Finally, in chapter 3, we are going to talk about clinical test required to diagnose the root cause of chronic constipation. And again, diagnosing the root cause will not be only about talking to a general practitioner, gastroenterologist. It will also be about other specialties such as cardiology, rheumatology, endocrinology, and so on. So we are going to talk in detail about it. And we have listed 43 different tests and examinations for it. And we'll start from a very simple test that will run by run by general practitioner, then simple test that will run by gastroenterologist. Then we will keep on getting to more complex, and as you go to more complex tests, we will also get more rare cases, because in some cases, some of the people will have very rare conditions that impacting chronic constipation, and these figuring out or solving the puzzle or the of this identified root cause, or not getting lost in this maze of different root causes, where these clinical tests will help you identify exact root cause and will be informative enough to have an educated discussion with your specialist or doctors. Finally, at the end of the chapter, we talk about our mission is that we want to make a GI care more accessible, actionable. So, in order to make this actionable, we are going to share with you the list of checklist and actionable guides that go along with this episode. And this episode is going to be a very long one because it's very comprehensive, and it's going to about more than 2 hours long because it's very packed with information dense. And I really hope that a chronic constipation patients will watch this, listen this, and take notes, and this will be so useful to you and the chronic constipated patients, or whether you are taking care of someone, that will help you identify and have a discussion with your doctor. And talking about doctors, please understand that this is not a substitute to clinical care. This is complementary to clinical care, and our role or our job or our goal is to provide you with information only. And for more personalized care, personalized advice, treatment, diagnosis, please consult your healthcare provider so that you get very accurate A, diagnosis, and B, treatment plan, because we wish you for speedy recovery, we wish you for preventing disease, and we wish you a high quality of life. So Let's begin. In this chapter, we are going to talk about biomarkers and why understanding biomarkers is important. As I have been mentioning that everybody's body is different, our root causes are different, and we have to go through a series of trial and error to understand the root causes behind what is really causing our constipation. I have gone through the confusing journey, and I'm sure many of you also have been confused in the about what's really causing it, what to try, what not to try. And in that personal journey, I think understanding biomarkers are super important. Important to help diagnose, important to predict, important to understand whether we are responding to treatment or not, understanding whether safe or not. All of these are super important. And what are biomarkers in the first place? So biomarkers are like your secret codes in our DNA, cells, tissues, blood, urine, and so on. And our doctors may send us for different tests. And depending on the report of the test or values in the biomarkers, it can be help us to diagnose the correct root cause. And also, before we talk about different test and diagnostic path, so understanding the foundational biomarkers is super important. If you go to our one of the previous episodes in understanding everything about constipation, where I talked about bowel movement as a biomarker. So bowel movement is a visual biomarker. Here I'm talking about the chemical biomarkers, blood biomarkers, and so on. And understanding them will help us ask a right question to our doctors so that they can prescribe the right diagnostic test, and depending on the result, they can personalize our treatment plan. Remember, everybody's body is different. One thing that work for one person may not work for another. Hence, to have that very precise, tailored, and personalized treatment plan, having the right values to the biomarkers are super important. Today, we are going to talk about 7 different those crucial biomarkers. Let's dive in. Now let's dive deep in about our number 1 biomarker, which is diagnostic biomarkers. These biomarkers can help us confirm if we have a specific disease or not. Let us walk through an example with 3 different specific diseases. 1, celiac disease, number 2, IBS, and number 3, IBD. Let's talk about celiac disease. So first of all, celiac disease is an autoimmune condition where ingestion of a gluten leads to damage in the small intestine. And identifying celiac disease early is crucial for managing symptoms and preventing complications. So there are 2 biomarkers I can explain here. One is tissue transglutaminase and B, endomysial antibodies. So these biomarkers are measured through a blood test. A healthcare professional will draw a small sample of blood, which is then analyzed in a laboratory for the presence of these antibodies. If there are elevated levels of tissue transglutaminase and endomysial antibodies, then it can confirm that it's celiac disease. Whereas in the absence of these antibodies, it is easy to diagnose that the celiac disease doesn't exist. And for patients who have positive signals, then it can be sent for intestinal biopsy to confirm the diagnosis. So this is how a simple biomarker test can be used to confirm whether someone has celiac disease or not. Now let's talk about IBD before IBS, because the biomarkers we measure for IBD will also be useful for IBS diagnosis. So inflammatory bowel disease includes Crohn's disease and ulcerative colitis, which are inflammatory conditions of the gastrointestinal tract. And obviously, accurate diagnosis is essential for effective management. So there are 3 biomarkers measured. 1, fecal calprotectin. 2, C-reactive protein. 3, erythrocyte sedimentation rate. Fecal calprotectin test is taken through a stool sample, and CRP and ESR, C-reactive protein erythrocyte sedimentation rate, ESR, is measured through blood test. And when high levels of fecal calprotectin mean indicate inflammation in intestines, suggesting IBD. And elevated levels of CRP and ESR indicate systemic inflammation, which is common in IBD. So, high fecal calprotectin levels combined with elevated CRP and ESR are strong indicators of IBD. And obviously, these patients should undergo diagnostic procedures such as colonoscopy or biopsy to confirm the diagnosis. And here is where the normal levels of fecal calprotectin or CRP and ESR suggest that IBD is unlikely and other causes of symptoms should be considered. This is when the difference between IBD and IBS. IBD can be measured through these biomarkers and help to diagnose using it. But IBS, we do not know the real cause of it. And also, there aren't biomarkers to diagnose IBS with constipation or diarrhea or mixed. It is diagnosed through the ROM4 and through consultations with the gastroenterologist. So, absence of fecal calprotectin, CRP, and ESR can confirm the absence of IBD. What I mean by is low levels of it can confirm the absence of IBD, whereas it opens door for the possibility of IBS and IBS using ROM4 criteria, such as the symptoms, such as the triggers, such as the bowel movement trackers, the visual indicators, and the severity of symptoms. The gastroenterologist will, using their judgment, will diagnose the IBS. So that's the difference between IBD and IBS using the biomarkers. Let's talk about monitoring biomarkers. These biomarkers track the progression of disease and effective of the treatments. They provide valuable insight into how well a treatment is working and also help in adjustment in the therapy plans. For chronic constipation and other gastrointestinal disorders, monitoring these biomarkers can be crucial in managing ongoing conditions. So we are going to talk about a few different cases. Let's talk about monitoring biomarkers. Number one, monitoring biomarkers for inflammatory conditions. Number two, for cancer. For number three, Crohn's. And number four, we're going to talk about monitoring general physiological biomarkers. So let's start with monitoring inflammatory conditions. So inflammatory conditions such as Crohn's disease and ulcerative colitis often require close monitoring to manage flare-ups and maintain remission. Key biomarkers help in tracking inflammation and guiding treatment decisions. 3. It's similar to we talk about in diagnosis. 3. CRP, C-reactive protein, ESR, erythrocyte sedimentation rate, and 3. Fecal calprotectin. So CRP and ESR are drawn through blood test and it's sent to laboratory, and fecal calprotectin is done through stool test. So elevated levels indicate that active inflammation in the body. Elevated levels of CRP and ESR indicate the active inflammation in the body. And response to the treatment plan, if that rises, then the body is not responding to treatment, and that level start decreasing. That means the body is responding to treatment. And same with the fecal calprotectin as well. So high levels in stool indicate intestinal inflammation, distinguishing between inflammatory conditions like IBD and non-inflammatory conditions like IBS. So obviously, whenever there is a treatment, the positive signals that we are looking for are decreasing levels of CRP, ESR, and fecal calprotectin, suggesting that the inflammation is effectively managed. And the negative signals that we don't want to look for is we don't want to have is persistently high or increasing levels of these biomarkers, suggesting ongoing or worsening treatment, suggesting that inflammation is not being managed and is necessitate the reassessment of the treatment plan or escalation of the treatment plans. So this is how even monitoring these three can help a doctor tailor, change, or personalize the treatment plans. Similarly, it's also about monitoring biomarkers are essential in cancer progression and treatment response, especially in the gastrointestinal cancers such as colorectal cancer and pancreatic cancer. So biomarkers measured are carcinoembryonic antigen CEA and cancer antigen 199 CA19-9. So both of these biomarkers are measured through blood test. Obviously, blood sample is drawn and analyzed in laboratory to measure these cancers markers. And the elevated levels can indicate the presence or reoccurrence of colorectal cancer, and monitoring CEA levels over time helps track the effectiveness of the treatment and detect reoccurrence. So CA19-9 elevated levels are often associated with pancreatic cancer, but can also be elevated in other gastrointestinal cancers. So monitoring CA19-9 can help track tumor size and treatment response. And the positive signals that we are looking for are decreasing or stable levels of CEA and CA19-9 that indicate effective treatment and reduced tumor activity. And obviously, negative signals that we don't want are increasing levels of CEA and CA19-9 that may suggest that cancer progression or reoccurrence, necessitating further diagnostic testing and potential change in treatment. Similarly, about third, specifically for Crohn's disease, protein-based biomarkers can detect remission, providing a non-invasive alternative to endoscopy, which is the gold standard. The biomarkers measured, again, CRP, C reactive protein, fecal calprotectin, and C serum albumin. And CRP and serum albumin are measured through blood test. I repeat again, for fecal calprotectin is through stool test, and the elevated levels of CRP and fecal calprotectin indicates the Crohn's disease, whereas low levels of serum albumin indicate poor nutritional status and inflammation. So for positive signals that we are looking for are decreasing levels of CRP and fecal calprotectin, suggesting effective treatment and remission, and normal level albumin levels indicates improved nutritional status and reduced inflammation. And obviously, opposite of that is we don't want persistently high or increasing levels of CRP and fecal calprotectin, suggesting ongoing inflammation and disease activity. Therefore, it requires reassessment of treatment plans. And fourth one, when we talk about monitoring general physiological markers like fever and blood pressure can also provide valuable insights. So biomarker measures are two: A, body temperature, and B, blood pressure. So body temperature is obviously measured through thermometer. Persistent fever can indicate infection or inflammation, and blood pressure is measured through sphygmomanometer, where blood pressure readings help assess cardiovascular health and response to treatment. So elevated level of temperature indicates infection and inflammation, and blood pressure, elevated or decreased blood pressure can indicate cardiovascular issues or response to treatments. So positive signals. So body temperature getting back to normal, and also blood pressure getting back to normal, which is between normally 80 to 120, suggests that there is effective management of underlying conditions. And obviously, what we don't want is persistent fever or abnormal blood pressures. We do not want that. If that happens, then we want to think about reassessing the treatment plans and obviously talk to our healthcare provider and doctor about it. So these four examples, IBD, especially Crohn's, cancer, and just general physiological monitoring, are very important biomarkers. And we got to calibrate these time and again to measure the effectiveness of our treatment plans. And obviously, the gastroenterologist can dial up and dial down based on the values and lab results. So, as a patient, understanding these biomarkers, what it means, what is the positive signal, what's the negative signal, is important to ask a specific questions to, to our gastroenterologist so that we can shorten the path of recovery. Let's talk about our third biomarker, which is pharmacodynamic biomarkers, which is also known as response biomarkers. These indicators are important to measure the effectiveness of a treatment, helping physicians at doses, determine treatment duration, and make informed decisions about therapy adjustments. For example, changes in your heart rate or blood pressure after taking a medication are simple but effective pharmacodynamic biomarkers. Pharmacodynamic biomarkers can provide critical insights into how well a medication is working. As I said earlier, they help physicians make informed decisions about dosing, treatment duration, and necessity adjustments. So we're talking about pharmacodynamic biomarkers for drug response. And the four biomarkers we're going to talk about are heart rate, blood pressure, serum drug levels, and gut motility. And heart rate is measured using ECG. This can be done in clinical setting or using wearables. Blood pressure is using sphygmomanometer, which can be regularly monitored at home or during clinical visits. Serum drug levels measured through blood test, and gut motility assessed using imaging techniques such as scintigraphy or motility capsule that track the movement of contents through the digestive tract. And what are these values and what those values mean? So heart rate and blood pressure. Changes in these parameters can indicate how well a cardiovascular or anti-hypertensive drug is working. Serum drug levels. The concentration of a drug in the blood helps determine if the dose is therapeutic, too high, or too low. Gut motility. Improved gut motility can indicate a positive response to treatments for chronic constipation patients or any other chronic GI motility disorders. And optimal signals that we are looking for are heart rate, blood pressure, and serum drug levels indicate that medication is effective and well dosed, which is at the optimal level. And improved gut motility suggests that successful management of constipation and other motility disorders. And what we don't want is abnormal heart rate, blood pressure, or serum drug levels that may indicate a need for dose adjustments or alternative therapies. And obviously, lack of improvements in gut motility signals the need for re-evaluation of the treatment plan. After this, let's talk a bit about pharmacodynamic biomarkers for inflammatory response. So inflammatory response biomarkers are particularly useful in identifying the most effective treatments for conditions such as esophageal cancer and other inflammatory diseases. So we're talking about three biomarkers here. Number one, C-reactive protein, CRP. Number two, interleukin-6, which is IL-6. Third, tumor necrosis factor, that's alpha, TNF, that's alpha. So these biomarkers are measured through a blood test. And let's understand the values and meaning. So CRP, so elevated levels of CRP indicate inflammation, and decreasing levels suggest a positive response to anti-inflammatory or cancer treatments. IL-6 and TNF-alpha, high levels are associated with inflammation and cancer progression, and reducing levels indicate the treatment is effectively managing the inflammatory response. And obviously, we want decreased levels of CRP, IL-6, and TNF-alpha, and we do not want the persistently high or increasing levels of CRP, IL-6, and TNF-alpha. If this happens, then obviously it may require recalibration, changes in doses, treatment therapies, and timing. So we'll have to discuss that with our doctor. Let's also briefly talk about pharmacodynamic biomarkers for other gastrointestinal disorders. So for gastrointestinal conditions, pharmacodynamic biomarkers help in adjusting treatments to improve patient outcomes, particularly in managing chronic constipation and related disorders. Let's talk about three biomarkers measured. Number one is bowel movement frequency and consistency. Remember, we talked about how to use bowel movement as a biomarker, and this is one of the pharmacodynamic biomarkers we talked about in chapter 2. So number two, serum electrolytes such as potassium and sodium. And third is transit time measured to SITZ, SITZ marker study or motility capsules. So how these biomarkers are taken? For bowel movement frequency and consistency, obviously that's using very active patient diaries or digital apps. So what we require, we have talked about Bristol stool chart so that we can be standardized and reduce the subjectivity and increase the objectivity of it. So it can be used in diary or apps. So number two is serum electrolyte. It's measured through blood test. And number three, transit time, assessed using SITZ marker study. In the next chapter, we are going to talk about the test we require to diagnose the root cause of our chronic constipation conditions. So transit time. So patients swallow capsules containing radio opaque markers, and X-rays are taken over several days to track the movement through the colon. And what are the values that we are looking for? Obviously, if you know about Bristol stool chart, we're talking about regular well-formed, snake-shaped bowel movements And for serum electrolyte, we're looking for balanced levels that suggest treatments are not causing any harmful side effects such as electrolyte imbalance. And normal transit time indicates that effective motility and treatment response. Obviously, positive signals are improved bowel movement patterns, balanced electrolytes, and normal transit time. That means treatment is effective. And other than this, irregular bowel movements, electrolyte imbalance, or abnormal transit time or slow transit time indicates treatment adjustment required. So, pharmacodynamic biomarkers are essential for tailoring treatments to each patient's unique response. They provide feedback on how well a therapy is working, drug is working, and guiding adjustments to improve effectiveness and safety. So, if you are managing chronic constipation or other gastrointestinal issues, we got to talk to your doctor and pharmacodynamic biomarkers. So, understanding unique response will help recalibrate to the precise and personalized treatment plans that works just for you. Now, let's talk about our fourth biomarker, which is predictive biomarkers. And that will help you identify or predict the risks whether you will develop that particular disease or not, and also whether how better or worse you'll respond to a particular treatment. And these biomarkers are valuable for identifying the future health risk and treatment responses. By identifying these biomarkers, healthcare providers can obviously tailor preventative measures and therapies to suit your individual needs and enhancing the effectiveness of treatments and potentially preventing disease progression. So let's talk about predictive biomarkers for cancer risk. So predictive biomarkers are particularly useful in assessing cancer risks, including gastrointestinal cancers such as colorectal or pancreatic. So two categories of biomarkers measured are BRCA1 and BRCA2 gene mutations. That's one category. And second category is APC gene mutations. So BRCA1 and BRCA2 gene mutations are measured through genetic testing. A blood or saliva samples is collected and analyzed for mutations in these genes. And APC gene mutations are also measured through genetic testing. A blood sample is collected and analyzed to detect mutations in APC gene associated with the familial adenomatous polyposis FAP and increased risk of colorectal cancer. So BRCA1 and BRCA2 gene mutations. So presence of these mutations indicate at a higher risk for certain cancers, including breast, ovarian, and also pancreatic cancer. And APC gene mutations. Presence of mutations in APC gene indicate high risk for colorectal cancer and potential development of polyps in the colon. And obviously, when we do this genetic testing, the positive signal is that the absence of these genes. And identifying these mutations allow us for target preventative measures such as increased surveillance, lifestyle changes, and potentially prophylactic treatments. And the best case scenario is absence of these mutations reduces the likelihood of developing these cancers, but obviously regular and monitoring remain essential, especially if you have the family history of cancers. One important note I want to add is, so these genetic testing for conditions like BRCA mutations may not be routinely recommended for everyone. So it's important to consult with healthcare professional for personalized guidance. And normally, these tests are start from very basic, and you can't identify the root causes. Then progressively, more and more complex causes are tested. And obviously, if you have gone through all of these simple tests and the root cause is not identified to rule out cancer, obviously these tests can be done, and you can ask for it, advocate for it. And remember, in last episode I talked about use the magical word medical necessity, and request your provider also to use it. That will help you get the treatment necessary. This is a suggestion, not a medical advice. So let's talk about predictive biomarkers for other gastrointestinal disorders such as IBD and IBS. So two categories of biomarkers measured are NOD2 gene mutations, and second one is serologic markers like anti-Saccharomyces cerevisiae antibodies, ASCA. So the NOD2 gene mutations are measured through, again, genetic testing, through blood sample is taken, and second for ASCA is measured through blood test. Again, blood sample is drawn. So presence of NOD2 gene mutation indicates that higher risk for Crohn's disease, and presence of antibodies suggests the presence of ASCA antibodies suggest increased risk for Crohn's disease and can help differentiate it from ulcerative colitis. And obviously, the best case scenario is absence of these mutations. And if there are, identifying these biomarkers allows for early intervention and targeted monitoring, potentially preventing disease progression and managing symptoms more effectively. And absence of markers reduces the likelihood of developing these conditions but does not eliminate the need for regular checkups and monitoring. Now, let's talk about predictive biomarkers for treatment response. So predictive biomarkers can also forecast how well you might respond to a specific treatments, guiding a personalized therapy plans. So two biomarkers measured are UGT1A1 gene polymorphism. Second, thiopurine methyltransferase TPMT enzyme activity. So UGT1A1 gene polymorphisms are measured through, again, genetic testing. A blood sample is collected and analyzed to detect polymorphisms in the UGT1A1 gene, which affect drug metabolism. And TPMT enzyme activity is measured through blood test. Again, the blood sample is drawn and analyzed to determine the activity of TPMT enzyme, which is involved in metabolism of thiopurine drugs used in IBD treatment. So, UGT1A1 gene polymorphism can predict the risk of adverse reaction to drugs like irinotecan used in cancer treatment, and TPMT enzyme activity. Low TPMT activity indicates a higher risk of toxicity from thiopurine drugs, requiring dose adjustments or alternative treatments. And the positive signals we are looking for are, we got to identify these biomarkers that allows for personalized treatment plans and optimizing drug efficacy and minimizing adverse effects. So absence of these polymorphism or normal enzyme activity suggests standard dosing regimens can be safely followed. So again, these predictive biomarkers are powerful tool for personalized medicine. They can help identify risk and guide treatment decisions, ensuring that therapies are tailored to each individual's unique genetic and biological makeup. Now, let's talk about our fifth biomarker, which is prognosis biomarker. But for me, when I first went through these biomarkers, on the surface, prognosis biomarker and predictive biomarker sound somehow the same to me, but I wanted to understand the difference. Hence, let's clarify the difference between prognosis biomarker and predictive biomarkers. Both are essential for personalized medicine, but they serve a different purpose. Prognosis biomarkers provide information about likely course of disease, including its potential to progress, reoccur, or lead to a specific health outcomes. For example, in people with active IBD, a blood-based biomarkers can indicate whether the disease might become more aggressive and if prompt treatment escalation is needed. Whereas predictive biomarkers indicate how likely you are to respond to a specific treatment. They help in selecting the most effective therapy for your condition. For instance, certain genetic mutations can predict whether a patient will respond well to a particular cancer drug. We talk about that in our fourth biomarker. So in summary, prognosis biomarkers help forecast the disease's trajectory, while predictive biomarkers help forecast the effectiveness of a particular treatment. Now, after understanding these differences, let's talk deeper about prognosis biomarkers. So, prognosis biomarkers offer valuable insights into the future progression of a diagnosed condition. By understanding these biomarkers, healthcare providers can predict the course of a disease, identify at risk for severe outcomes, and tailor treatments to manage the conditions more effectively. It's important to note that, however, some prognostic biomarkers may not be definitive. and a combination of factors is often used for risk assessment. Obviously, for this reason, consulting a healthcare provider for professional and personalized interpretation is crucial. So let's talk one by one and talk about some examples. For example, prognosis biomarkers for inflammatory bowel disease. For people with active inflammatory bowel disease, prognosis biomarkers can indicate whether the disease might become more aggressive if a prompt treatment escalation is needed. And for that, four biomarkers are measured. One, C-reactive protein. Two, fecal calprotectin. Three, serum albumin. Four, genetic markers, NOD2 mutations. All of these things we talked about earlier as well. So elevated CRP, fecal calprotectin may indicate the progression, and the low levels of serum albumin indicates poor nutrition status and chronic inflammation, which are associated with worse outcomes in IBD. And obviously, genetic mutations like those in NOD2 gene can indicate high risk for severe disease. And obviously, we don't want the presence of elevated CRP and fecal calprotectin levels. We don't want low serum albumin, and we don't want the positive genetic markers. We want low normal levels of CRP, calprotectin, and normal levels of serum albumin, and absence of genetic mutations. Also, let's talk a bit about the prognosis biomarkers for cancer. Again, the four biomarkers measured are carcinoembryonic antigen, CEA, cancer antigen 19-9, CA 19-9, KRAS mutations, and microsatellite instability, MSI. So CA and CA19-, as we talked about earlier, measured through blood test, and KRAS mutation and MSI is measured through genetic testing for tumor tissue obtained via biopsy. And obviously, we don't want the elevated levels of it. So present elevated levels of CA and CA19-9. We don't want KRAS mutations. So we don't want the presence of these mutations, which generally associated with poorer prognosis and resistance to certain therapies. And MSI, high levels of MSI are associated with better prognosis and response to certain immunotherapies. Again, for positive signals are identifying elevated CA and CA-19 levels, KRAS mutations, and MSI status can help tailor treatment plans and surveillance strategies to improve outcomes. And what we want is negative signals are normal levels of these biomarkers and absence of high-risk genetic markers suggest a better prognosis and lower risk of occurrence. So let's also talk about prognostic biomarkers for chronic liver disease. So in chronic liver diseases, prognostic biomarkers can predict disease progression and the likelihood of complications such as liver cirrhosis or liver cancer. And four biomarkers measured are alpha fetoprotein, AFP, bilirubin, aspartate aminotransferase, AST, and alanine aminotransferase, ALT, and four platelet counts. So AFP, bilirubin, AST, and ALT are measured through blood test, and platelet counts, the part of complete blood count, CBC test, where a blood sample is drawn to measure the normal platelets. In short, all these four are measured through blood test. And what does value and their meanings? So AFP, elevated levels can indicate the absence of liver cancer. Elevated levels can indicate the presence of liver cancer. Bilirubin, high levels suggest the liver dysfunction and can predict disease progression. And AST and ALT, elevated levels indicated liver inflammation and damage. And platelet count, low levels can indicate advanced liver disease and portal hypertension. So monitoring these biomarkers help predict the risks of liver cancer, cirrhosis, and other complications, guiding proper, appropriate interventions and monitoring. And normal levels of these biomarkers indicate stable liver function and a lower risk of complications. Hence, prognosis biomarkers provide critical insights into future course of disease. By understanding these biomarkers, healthcare providers can tailor treatment plans to manage conditions more effectively and improve long-term outcomes. Now it's time to talk about our sixth biomarker, which is susceptibility and risk biomarkers. They provide valuable insights into your likelihood of developing a specific gastrointestinal disease. By identifying these biomarkers, our healthcare providers can implement early interventions, preventative measures and personalized monitoring to manage our gastrointestinal health proactively. Now let's look at some key susceptibility and risk biomarkers for various gastrointestinal conditions such as stomach cancer, colorectal cancer, and inflammatory bowel disease. Let's start with susceptibility and risk biomarkers for stomach cancer. Stomach cancer or gastric cancer is a significant concern in gastrointestinal health. Certain biomarkers can indicate an increased risk of developing this disease. So two biomarkers, one, H. pylori infection biomarker, two, E. cadherin, CSD1 gene mutations. H. pylori infection biomarkers are measured through breath test, stool antigen test, and blood test. A non-invasive breath test or stool sample is often used to detect H. pylori infections, while blood tests can identify antibodies. E. cadherin, CDH1 gene mutations measured through genetic testing. It can be drawn through blood or saliva and analyzed for mutations in the CDH1 gene. So presence of H. pylori indicates an increased risk for stomach cancer and peptic ulcer. I have had H. pylori, then the treatment plan for H. pylori is 7 days of antibiotic and then it's gone. So it's very common. But also if there is a presence of H. pylori, it increases the probability of the likelihood of stomach cancer. So E. cadherin, CD1H1 gene mutations. Mutations in the CD1 gene are associated with higher risks of hereditary diffuse gastric cancer. Then identifying these biomarkers allows for early interventions such as H. pylori eradication therapy, which I went through, and regular endoscopic monitoring for individuals with CDH1 mutations. And obviously, absence of these biomarkers reduces the likelihood of developing stomach cancer. But again, regular screening and monitoring are essential, especially if we have the family history of it. So important note to add is, so genetic testing for CDH1 mutation may not be routinely recommended for everyone. Therefore, it's important to consult with a healthcare professional for a personalized medicine. It's a personal discussion with your provider. We are providing this information for you so that you can have a conversation with them. This is not a medical advice from me. Now, let's talk about susceptibility and risk biomarkers for colorectal cancer. So colorectal cancer is another critical area where susceptibility and risk biomarkers play a significant role in early detection and prevention. So two biomarkers we're going to talk about are APC gene mutations and two Lynch syndrome biomarkers, MLH1, MSH2 gene mutations. And these are done through genetic testing. For APC gene mutations, a blood sample or saliva, and for Lynch syndrome biomarkers is to blood samples to identify mutation in mismatch between repair genes associated with Lynch syndrome. And presence of mutations in APC gene indicates a high risk of risk for FAP and colorectal cancer. And mutations in mismatch repair genes, MLH1 and MSH2, are associated with the increased risk for colorectal and other cancers. And obviously, if these mutations are identified, then it allows for targeted preventative measures such as increased surveillance, prophylactic surgeries, and lifestyle modifications to reduce cancer risk. And absence of these medications reduces the likelihood of developing colorectal cancer. But again, regular screening and monitoring remain important for early detection, especially when you have family history. I must add, though, genetic testing for conditions like Lynch syndrome may not be routinely recommended for everyone. It's important to consult with a healthcare professional for personalized guidance. I haven't had these tests done myself. And again, I recognize that people may be in a different spectrum of severity. And for them, especially when the root cause is not detected, then eliminating the root cause, going one by one and getting this test done, maybe click the bullseye and identify the root cause, and then therapies can be started to target that particular problem. And now let's talk about susceptibility and risk biomarkers for inflammatory bowel disease. We've talked about in the diagnosis, prognosis, and many places as well, because IBD is very severe form of gastrointestinal disease. And disease for inflammatory bowel disease such as Crohn's and ulcerative colitis, certain biomarkers can indicate a high susceptibility to these chronic conditions. Biomarkers measures, we're talking about three. one, NOD2 gene mutations. Number two, serologic markers like anti-Saccharomyces cerevisiae antibodies, ASCA, interleukin 23 receptor, IL-23R gene variants. My God, these are very difficult to pronounce names. So these NOD2 gene mutations are measured through genetic testing. Obviously, saliva or blood sample is drawn. ASCA is measured through blood test, and IL-23R gene test is measured through genetic testing. A blood or saliva sample is collected. And presence of mutations in NOD2 gene indicates a high risk for Crohn's disease. The presence of ASCA antibodies suggests an increased risk for Crohn's disease and can help differentiate it from ulcerative colitis. And IL-23R gene variant, certain variants in IL-23R gene are associated with increased risks of developing IBD. And identifying these biomarkers allows for obviously having talking about repeatedly for early interventions, targeted monitoring, and personalized treatment plans to manage symptoms and prevent disease progression. An absence of these biomarkers reduces the likelihood of developing IBD. Again, if you have symptoms and family history, regular checkups and monitorings remain essential. It's important to note that while susceptibility and risk biomarkers provide valuable insights, they are not definitive predictors. Some biomarkers have varying degree of risk association, and a combination of factors is often used for risk assessment. Again, that's the reason why these are information purpose only. For accurate diagnosis, consulting a professional for personalized interpretation is crucial. They can help you understand your individual risk and recommend appropriate preventative measures and monitoring strategies. Now let's talk about our seventh and final biomarker, which is safety biomarkers. These biomarkers measure the possibility of a toxic or adverse reaction that can develop from treatment. For chronic constipation and other gastrointestinal disorders, safety biomarkers are crucial in ensuring that treatment are helping, not harming, or not causing harm. And these safety biomarkers can provide valuable information about the potential toxic effects of treatments. By monitoring these biomarkers, healthcare providers can detect early signs of adverse reaction, adjust treatments accordingly, and ensure the most important thing, the patient's safety. Here we'll walk through three different examples on liver health, kidney health, stomach linings, and intestines. So let's begin with safety biomarkers for liver health. One of the most critical areas where safety biomarkers are used in monitoring liver health. Treatments for gastrointestinal disorders can sometimes affect the liver, making it essential to track specific biomarkers. Here we're talking about two categories. Number one, aminotransferase, ALT and AST. Two, bilirubin. ALT and AST are measured through blood test, and bilirubin also is measured through blood test. So elevated levels of ALT and AST indicate liver cell damage. ALT is more specific to liver, while AST can also indicate damage to other organs like the heart or muscles. Bilirubin, high levels of bilirubin, a yellow pigment produced by the breakdown of red blood cells, indicate the liver dysfunction and can lead to jaundice. So what we look for is normal levels of ALT, AST, and bilirubin that suggest the liver is functioning properly and the treatment is not causing harm. So if there is the elevated levels of ALT, AST, and bilirubin that indicate potential liver damage, it necessitated the review of treatment plan and possibly discontinuing the medication or adjusting the medication. The important note here is regularly monitoring these biomarkers is crucial for patients' long-term medication or those with pre-existing liver conditions to prevent serious complications. Now let's move on to safety biomarkers for kidney health. Obviously, another essential area for safety biomarker is kidney health. Treatments, especially for those gastrointestinal health, can sometimes impact kidney function, making it vital to monitor specific biomarkers. Two, we are talking about one, serum creatinine, two, blood urea nitrogen, BUN. Both of these are measured through blood test, and when there is elevated levels of serum creatinine, it indicates impaired kidney function or kidney damage. Creatinine is a waste product produced by muscle metabolism and excreted by the kidneys. So BUN, elevated levels indicate reduced kidney function. Urea nitrogen is a waste product formed from protein breakdown and excreted by the kidneys. So what we look for is normal levels of serum creatinine and BUN. That suggests that kidney are functioning well and the treatment is not causing harm. So if we see the elevated levels, that means there is a potential kidney damage which requires the reassessment of the treatment plan. The important note is patients with chronic kidney disease or those on medications that affect kidney function should have these biomarkers monitored regularly to prevent more complication. Now let's move on to safety biomarkers for gastrointestinal tract. So safety biomarkers are also vital for monitoring gastrointestinal tract, especially when using treatments that can cause irritation or damage to the stomach lining and intestines. So we can talk about two biomarkers. One, fecal occult blood test, FOBT, and second, serum albumin. So FOBT is measured through stool samples, whereas serum albumin is measured through blood test. So if there is a positive FOBT result that indicate bleeding in the gastrointestinal tract, which could be due to ulcer, polyps, or other conditions. Remember, we talk about different colors of the blood. For example, if it's bright red, it's more in the outer section of rectum due to hemorrhoids or fissure. It's in a brown in color, maybe in the lower intestine, large intestines. If in more darker in color or more brown in color, it's in black or black in color. So higher the bleeding is, the darker the color of blood is, and FOBT can help identify that blood and more accurately. So serum albumin low level indicates poor liver function, malnutrition, or chronic inflammation. So we want negative FOBT results and normal serum albumin levels. That suggests that gastrointestinal tract is healthy and treatment is not causing harm. And positive fecal occult blood test, FOBT results, and lower serum albumin levels indicate that potential gastrointestinal damage and poor nutritional status requiring further investigation and potential treatment adjustment. So the important note is regular monitoring of these biomarkers is essential for long-term medication patients that can affect gastrointestinal tract to ensure early detection and prevention of complications. So these safety and risk safety biomarkers are really important that we don't have any adverse effect or adverse reaction that complicates. So our body is a machine, it's a complex machine. There is not a singular one organ impact. It's always multiple organs impact because everything is interconnected. So when you are treating for one organ or one specific condition, we have to make sure that it doesn't impact other ones or exacerbates the complications. And for that, these safety biomarkers are important. And always consult with your healthcare provider for a very personalized interpretation. And some of these tests may not be included as a standard plan. You may have to fight like an MMA fighter to get this test done. And we are going to talk about those tests in the future, in the next chapter. Test. And in test, we are divided into following sequence. One is something for at-home test that we can talk about, which can do for this preliminary ideas. Then the second category is the test that will be run by primary care doctor. Third category is the test that will be run by gastro specialist or gastroenterologist. And the fourth test that need to be run if the root cause is not identified. As we talk about, the causes may be neurological, psychological, anatomical, physiological, and so on. And you have to get the test done. We're going to talk about those advanced level tests that need to be done in order to pinpoint the root cause. And this understanding these foundational biomarkers are super important. As we wrap up this chapter, let's summarize those 7 biomarkers we talked about. Let's start with number 1, diagnostic biomarkers that help identify if a person has a disease or disorder. For example, test for celiac disease, IBS, and IBD that can pinpoint the exact cause of chronic constipation. 2, monitoring biomarkers that show how a disease develops and responds to treatment. So regularly checking inflammation levels and other indicators can track disease progression and treatment effectiveness. Third, pharmacodynamic biomarkers indicate how our body responds to a drug or treatment or therapy. These biomarkers can guide dosing and treatment adjustments to optimize the effectiveness and minimum side effects. Four, predictive biomarkers that forecast our risk of developing a disease and likely respond to treatment. They help in choosing the most appropriate therapies for conditions like cancer and gastrointestinal disorders. Number five, prognostic biomarkers provide information about likely course of disease, including its potential to progress or reoccur. For example, certain biomarkers in IBD can indicate whether disease might become more aggressive. Six, susceptibility and risk biomarkers evaluate the risk level of whether you have a disease or disorder before receiving a diagnosis. Identifying these biomarkers can early lead to preventative measures and targeted monitoring. And seven, the final one, safety biomarkers measure the possibility of toxic or adverse reaction to treatment. Monitoring liver, kidney, and intestines, stomach linings are useful to ensure treatments are safe and effective. It helps, it doesn't harm. Also, we got to recognize that these biomarkers are complex. Their challenges remain in accessibility, education, and affordability for testing. And many patients still face barriers in getting these important tests due to cost and lack of awareness. And we have talked about both of these, cost and lack of awareness. For cost, in previous episode, we talked about how to navigate US healthcare, how to demand tests, how to fight like an MMA fighter, how to advocate yourself, how to optimize for doctor's visit. And I laid out 20 different ways to spend less. I recommend watching that videos. So we are aware that cost is an important factor, and we want to make sure it's accessible to you and give you information so that you can advocate and fight to reduce that cost. And second thing about lack of awareness, this is exactly why we are creating this educational video content, so that you are aware that what are different tests are available, what different biomarkers you should be tracking. I keep on repeating that we must be scientists of our own body. We must know about our disease more than doctors do. And it's our responsibility because we live in our body and we live it 24/7. All the diseases are ours, all the preventions are ours, and the quality of life are ours. And in order to have high quality of life, we want to live pain-free, we want to prevent disease, we want to recover from disease, and we want to live a high-performing life. In order to do so, I hope these educational videos are super important. And also, fortunately, there are resources growing in this area. So, especially how we can use these biological markers to develop the right treatment for the right person at the right time. And advances in technology, the gene sequencing or test, or every year, if there are advances in technologies, we hope that the cost astronomical goes down and the precision medicine or personalized medicine will be more accessible, and every person can deserve very personalized, precise therapies, diagnosis, treatment plans that works the best for that person's body. We hope for that. Until then, what we have is our knowledge that empowers you to take the action. Until then, we have to be aware that treatment plans can have adverse effects. We have to be aware that we can take proactive preventative measures to prevent the disease. And even when we have genetic propensity, we can also talk about changing lifestyle diseases or prophylactic actions to make sure that those genetic mutations do not activate. After saying this, I like to conclude the chapter 2 and talk about different types of tests in the following chapters. Stay tuned. Now let's move on to our second chapter, which is at-home test we can do before we visit a doctor. As a chronic constipation patient, like I have navigated through the complexities of chronic constipation way before I visited a doctor. As I said earlier, even as a scientist of my own body, I wanted to understand what is really causing it. Today, I understand the different causes and broadly three categories. One is the lifestyle causes, second is the physiological causes, third is the neurological causes. In the physiological, I also mentioned emotional, uh, psychological, and so on. So let's get to understanding what are some of the at-home tests that we can do that gives the preliminary ideas that what is really causing it. And also, I want to double score or underscore that this is not a replacement to the clinical test or clinical care. This is only for our preliminary understanding of what's causing it. And perhaps after this, it will require clinical diagnosis or the conversation with your provider to understand the root causes and to confirm it. But these general tests are essential in understanding and what is really causing it. And we'll go as extensive as possible. And let me walk you through the quick overview of its chapter. So we have 15, not just 10, 15 at-home tests that we can do to understand different root causes of it. Let me enumerate quickly. First, we'll understand low fiber diet. We'll do a dietary fiber assessment. Number two, we'll do a poor dietary habits. For that, we will do simple elimination diet. Number three, we will check for lack of fluid intake. For that, we will do hydration test. Four, we also understand that caffeine abuse and overuse of alcohol can cause constipation. So we'll keep a dietary log. Five, drugs can cause constipation as well. So we'll do a medication review. Six, sedentary lifestyle. For that, we'll keep a physical activity log. Seven, we know that endocrine disorders, so that's hypothyroidism, can cause. For that, we do temperature test. Eight, we know that neurological diseases or neuropathy can cause it. For that, we'll do sensory and reflex checks. Nine, psychological issues. We know that stress and mental health assessment is useful in identifying the psychological issues. Number 10, impaired colonic motility. For that, we'll use abdominal massage. 11, for gut dysbiosis, we'll talk about probiotic supplement. 12, for defecation disorders, we'll check whether a squat position during bowel movement can help. Number 13, pelvic floor dysfunctions, we'll use biofeedback techniques. Number 14, slow transit constipation, we'll use bowel transit time test with markers or beetroot test. Or 15, for potential colorectal issues, we can use home stool blood test. So we'll talk about one of all of these in detail and help you run a at-home test that will give you a preliminary idea about what's really causing it and also what treatments are working or not. So let's dive deep. So let's start with our first cause, low fiber diet. And in order to test that, we will do dietary fiber assessment. So our purpose is to evaluate whether fiber intake is related to the digestive health. And this is how you can run it. So keep a simple diary for a week and measure the fiber intake and compare it against the dietary recommendations. For example, for women, it's about 25 grams per day, and for men, it's 35 grams at minimum per day. And you can use Bristol stool charts for objective evaluation of your stool. For example, type 1, 2, 3, 4, 5, 6, 7. Then what is the shape of your shape, size, smell, and other consistency, and so on. You can measure it objectively using Bristol stool chart. And if you have consistent low fiber diet and it's impacting your Bristol stool chart, usually to the type 1, type 2, which are more score shape, or the golf ball shape, or the very thick log like, then you know it's chronic constipation, it's causing it. The second test we can run is to check for cause of our chronic constipation. That could be our poor dietary choices or poor dietary habits. And the test we can run is a simple elimination diet. The purpose is to identify food intolerances or sensitivities that can cause chronic constipation or impair our gut health. For example, we can eliminate some of the trigger foods, such as for some people it can be dairy, for some people it can be gluten, soy, or certain high FODMAP foods. What we can do is we can put a food diary and eliminate all of these and then introduce one after another that can help us identify what is the trigger food that can help that's causing a chronic constipation. For example, in my case, dairy is not a problem, but even gluten is not a problem. I am not allergic to gluten, but if I use a huge amount of wheat, that can have some upsetting problem for me. But when I combine cheese and the white flour, that's a trigger for me that can cause chronic constipation. So to do that is simple elimination diet before and after. Then we can gradually start reintroducing it, and we can keep eating what doesn't trigger and eliminate what causes the problem for us. So this simple elimination diet can identify the trigger food element for us. The third cause is lack of fluid intake. What that means is dehydration. And we can do a simple hydration test. And the visual hydration test that we can do is a urine. So number one thing is we may be less frequently urinating it. And when we go, and the color of the urine will be, if you are not drinking enough water, will be dark yellow, or even severely dehydrated, it could be brown. The ideal color should be slightly light yellow or crystal white. And if you're drinking too much water, obviously frequency of urination will be higher and the color of the urine would be very, very crystal white. So that's how we can know we are dehydrated or not. Another factor we can clearly know is when we look at our Bristol stool chart, we may have more difficult dry stool. What happens is when the stool has to pass through from our digestive tract, in lack of insufficient water, our intestines will draw water from the stool and it will make it more dry and it will be difficult to pass through it. Even the gut motility will be impaired. So simple test is hydration test, and urine is a great example. And you can find other symptoms as well. For example, your lips can turn dry. Another symptom is you can start getting pimples on your face. I know that because I had dry lips and the pimples on the face, and that gets particularly severe during the winter because I live in Boston and the winters are quite dry inside the house. So the simple thing is to use use humidifier so that there is hydration, there is moisture around going on in the environment. Another thing is to deliberately start increasing the water, and you can check whether your water intake is impacting or not, usually using visual inspection of the stool following the Bristol stool chart. And here is how uh, hydration test can inform you that whether dehydration is the cause of constipation. Let's talk about the fourth one, caffeine abuse and overuse of alcohol. So in order to do this, we can simply use a dietary log test to monitor intake of caffeine and alcohol and its effect and their effects on the bowel habits. To do so, let's keep a dietary log in which we are measuring the amount of caffeine and alcohol that we take, and obviously how it impacts a bowel movement. And for objective evaluation, we can use Bristol stool chart, which I've explained many times. And we can do it for months and weeks and months, and then realize, okay, if there is a direct correlation or causation between our caffeine intake and alcohol intake, then we can confirm that it's because of caffeine and alcohol or alcohol. We don't have to do it pair it. We can isolate one particular variable, which is whether alcohol or caffeine, and we can run this experiment using a dietary log test and then identify the cause of our chronic constipation. And the reason why caffeine and alcohol I mentioned here is both of these elements are diuretic. That what that means is that promotes loss of water through urine, and that will contribute to dehydration. And when dehydration happens, obviously the stool becomes harder, it becomes cracks, and it's difficult to pass. Even the stomach lining becomes coarse and dry, so it's difficult to pass. It impairs gut motility. That's how it impacts chronic constipation. So do a dietary log test and identify yourself whether caffeine or alcohol is contributing to your chronic constipation. And number 5 cause is medication and drugs. The NSAID is medication for cardiology disease, liver functions, kidney disease, metabolic functions can also contribute to constipation. And in order to identify whether these medications are contributing, then what we can simply do is do a test for medication review. So to identify whether these medications are contributing to constipation or not, and list all the medications that we're taking, when you started taking, what's the doses amount you're taking, and then measure it is with the Bristol stool chart and start indicating whether type 1, type 2, type 3 bowel movements, and you take it for a multiple number of weeks, then you can have the data, and that data will help you identify whether those medications are causing or not. And sometimes it can be one medication, sometimes it can be a combination of multiple medications, and that richness of data will be helpful when you go to doctor's visit, and then doctor can obviously recalibrate the medication or dosages, or even give you another type of medication that may not impact chronic constipation, or they can pair it with some other form of medication that can induce have a laxative effects, because those medication may be absolutely necessary. Again, the medication review can tell whether those medications are impacting your chronic constipation. And if it's impactive, you can exactly identify the start date and the severity of that impact based on dosages. So do a medication review test to identify whether medication is impacting. Simple example is NSAIDs like ibuprofen can impact chronic constipation. Even the supplements, which such as the iron supplements, can impact chronic constipation as well. So do a comprehensive medication review test to identify whether medications are impacting your chronic constipation. And number 6 cause is sedentary lifestyle. And in order to test that, keep a simple physical activity log. And it will help to correlate physical activity levels with gastrointestinal health, such as our chronic constipation. And I did that. I went and did this test and identify if I don't walk at all, then the next morning I had severe constipation. I really have to push it hard, and my stools are very lumpy. Even when I am not doing any physical activity, my desire for drinking water or the thirst for water is less. So, in general, a sedentary lifestyle can hurt the cause chronic constipation. And when I measured it, if I do not even move for 2,000 steps, less than that, my constipation was way harder. So that's how I was able to identify, okay, sedentary lifestyles can cause chronic constipation. It may not be the only factor. There are multiple factors that contribute, but this can be one of the huge factors. The reason why is physical activity impacts the gut motility. Gut motility is the movement of a stool across the digestive system from small intestine to large intestines and through the rectum. But when you are not moving, then there is no sterolysis happening. I find it really difficult to pronounce that word, sterolysis, which is like pushing the muscles, pushing the stool downwards. And that doesn't happen properly. That'll impair the gut motility and cause chronic constipation. And when I started keeping it log, I was able to pinpoint saying, okay, even as much as 2,000 steps can be helpful. And then incrementally, I started adding more steps, 5,000 steps, 10,000 steps. Then I started running, started doing yoga, started doing HIIT. And that's how I'm living constipation free. So therefore, physical activity log can help identify and pinpoint whether sedentary lifestyle is contributing or causing to chronic constipation. Do this simple physical activity log, and that will help you identify the root cause. Now let's talk about our 7th test, which is to measure endocrine disorders, aka hypothyroidism. So the test we'll conduct is called temperature test. Every morning before you wake up, take the basal body temperature and take it for several days. And if it shows consistently low temperature, then it can indicate hypothyroidism, which can slow down the metabolic processes. And slowing down metabolic process can result in causing chronic constipation. So that's the correlation between slow metabolic process, and that is because of hypothyroidism, and that can cause indicated by lower basal body temperature for several days and consistently low basal body temperature. And obviously, this is not a complete diagnosis. It is just an indication to get an idea whether there is a slow metabolism going on. We know that neurological disorders can also contribute or cause to chronic constipation. And we can do by a simple test, which is called sensory and reflex checks. So to identify neuropathic issues affecting bowel movements, we can perform a simple basic sensory test like pin pricks or light touch in a different parts of the body. And we can test for reflexes. And if there is a reduced sensitivity or reflex action is slow, then we can somehow learn from that is there is some neurological disorders. And if available, we can also test that with reflex hammer if available. The slow to respond to reflexes can indicate neurological disorders. Of course, the caveat here is it's not definitive, it's not diagnostic. Obviously, we need neurogastroenterologists to diagnose that. But again, before we visit the doctor, these tests can simply help us get a general idea whether that may be the cause of our chronic constipation. Number 9, we know that psychological issues can also cause chronic constipation. And in order to test that, we can use stress and mental health assessment to identify psychological factors contributing to constipation. So, by simply keeping a daily journal detailing stress levels, mood, and bowel habits, we can use online validated stress or anxiety assessment tools if available. When we measure that stress and the bowel habits, we'll be able to correlate and identify the causes. In my case, I did that. So when I learned the following: A, whenever I'm stressed, I have a chronic constipation. When I sleep less, I triggered chronic constipation. And whenever I start doing more meditation exercises, my constipation was reduced. So I was able to measure that objectively using Bristol stool chart. So journaling stress and anxiety and mental health assessment can help you identify whether there are psychological issues causing chronic constipation. So number 10 cause can be because of impaired colonic motility. And in order to test that, we can simply do an abdominal massage for 10-15 minutes and check whether it stimulates the bowel movement and relieve constipation or not. So the process how to do that is just massage the abdomen in a clockwise for 10-15 minutes. 10-15 minutes like this. And then check whether it triggers bowel movement or not. If it does, then it's an indication that you have some form of impaired colonic motility. And the reason why it's the clockwise help is the large intestine starts from the left side, and when you move towards the clockwise direction, you're helping and pushing the stool in the large intestines manually, and that can be helpful. So simple abdominal massage can help us indicate whether our impaired colonic motility is impacting or causing our chronic constipation. Number 11, we know that gut dysbiosis can also cause chronic constipation. And in order to test that, we can simply run a test of probiotic supplement trial to assess if probiotics can alleviate constipation symptoms. So we can try probiotics as a supplement or in form of fermented food for 2 to 4 weeks or 6 weeks period of time, and then start measuring our impact on bowel movements. So if there is an impact, if there is which alleviates our symptoms, our shape, size, time, effort, everything starts reducing and towards getting the type 3 or type 4 of the Bristol stool chart, then we can know that we had got dysbiosis and probiotic supplement has some impact in that. Obviously, it may not be enough, but it can be helpful. Probiotic supplement trial can be helpful to get some indication that we have got dysbiosis that's causing chronic constipation. Number 12, defecation disorders can also cause chronic constipation. Now, in order to test that, we can simply do a bowel movement in a squatting position to check whether that position will facilitate easier and complete bowel movements. So what you can do is take any stool, elevate, put your feet on top of that so that the knee is higher than your hip, mimicking a squat position. So what that'll help is it'll help push the abdomen and also the rectum in a more straight line instead of a pipe. For example, our rectum should be like this straight vertically, but when you are in a sitting chair position, it becomes like this. So there is a blockage in here. So when you are in a squat position, it becomes straight and it is helped to defecate more easily and for complete bowel movement. And that helps, then that indicates some form of defecation disorder. It may not be extreme or it may be extreme. That can be diagnosed later. But if the squatting position is helpful, that can alleviate the chronic constipation symptoms, then that can indicate some defecation disorders. Again, for some, simply mimicking the squatting position can be enough. For others, there may be more treatment required. Always consult with your doctor, but it's a simple test you can do. Mimic the squat position while during the bowel movement. Number 13, pelvic floor dysfunction can also cause chronic constipation. First of all, what is pelvic floor? So pelvic floor muscles are those muscles that support A, bladder control, bowel function, and sexual health. So when these muscles doesn't work as it should, then it indicates pelvic floor function. So some of the symptoms you might see are: number one, you have urge to go all the time, but actually you don't need to go. That's number one. Number two is when you sneeze, laugh, or do exercise, there's an accidental leaking of urine. That's second. And third is sometimes you lose control over bowel or bladder control. So if you have these symptoms that indicate you have pelvic function, pelvic floor dysfunction. And there is a simple test that you can run. Number one is simply sit down and then try to contract your pelvic floor muscles, like as if you are trying to stop the flow of urine, and hold it for a few seconds and then relax. You can try that a couple of times or times and then realize whether you are able to do that or not more comfortably. And there is an issue in doing that that can indicate that you have a pelvic floor dysfunction. So other time you can try during urination. While continuing urination, you can try to stop urination and hold it for a few seconds. And if you're able to do that, then obviously your pelvic muscles can control the bladder. That means you don't, that indicates your pelvic floor muscles are working as it should be working. But if you can't do that, that can also indicate pelvic floor dysfunction. And third, which is more goes to a diagnostic side of it, is using a biofeedback. So biofeedback is you put some kind of equipment and you try to control the muscles after a certain stimuli, and whether you're able to do that or not, that can also tell that more definitively whether you have pelvic floor dysfunction or not. And how can you improve pelvic function when you realize that you have that is causing it? So there are multiple ways of doing it. I'll categorize into at home and after the post diagnosis from a clinician. So at home, you can start doing Kegel exercises, you can doing deep breathing exercises and pelvic floor stretches during yoga or any other form of exercises that can be immensely helpful to strengthen the pelvic floor muscles. And other is using biofeedback mechanisms with equipment and also physiotherapy from the physiotherapist or physio gastroenterologist. They can help you improve your pelvic floor muscles. So simple ways to test it. One, you can actually sit comfortably, hold the uh, hold the muscles, contract the pelvic floor muscles as if you're trying to hold the urine. That's one. Or try to hold the urine while urination. And third is using biofeedback. So this is how you can check whether you have pelvic floor dysfunction that's causing your chronic constipation. And obviously, this is preliminary indication, not a complete diagnosis. For that, you'll have to consult with your doctor. So, number 14, slow transit constipation can cause chronic constipation as well. So, what that means is it takes longer time for your stool to travel along your digestive tract. So, how can you simply measure that? How long does it take and confirm whether it's because of slow transit constipation? There are multiple ways of doing things. Number one way is to very simple at-home test, which is called beetroot test. What you can do is you can drink a glass of beetroot and then expect to have a red stool within 12 to 24 hours. And if you do not get red stool in that particular time frame, that can be the indicative that you have slow transit constipation. So what that means is you have a impaired gut motility. So gut motility is the movement of the stool in the digestive tract, and that can be impaired by many things. One of the things is obviously the neurological reasons in the gut area. Another could be the physiological reason is that because of lack of movement or exercise, the gut motility is impaired. So those are a couple of reasons that can cause gut motility. And if your chronic constipation is caused by impaired gut motility, which can categorize as slow transit constipation, this beetroot test can indicate that. So another way of again measuring the slow transit constipation is taking a capsule and adding a marker and ingest that and record how long does it take to come out during the bowel movement. So that is most commonly done using with collaboration with the healthcare provider. But again, this capsule or the beetroot, either of them can indicate whether you have slow transit constipation if it's taking more than 24 hours or more than that. So these are simple tests to monitor the passes of food and stool through the digestive tract. And if it takes longer than 24 hours, that indicates you have slow transit constipation. Now we come to the number 15. So chronic constipation can also be caused because of colorectal issues. And one of the ways to identify that is to check whether there is blood in our stool or not. And in order to verify that, we can conduct home stool blood test in order to check for hidden blood in the stool. And if there is blood in the stool, it can indicate more severe digestive problems. And obviously, we can do in two ways. Number one is the visual way. And when after our bowel movement, we can observe our bowel movement and check whether there are blood in our stool. For example, the blood could be in different colors: bright red, dark red, brown, and even darker. So each of these colors can indicate the origin of the blood. For example, black can indicate its origin is stomach, or brown can is small intestine, and as you go lower and lower, it can the brightness of red decreases. And if it is bright red, it can be hemorrhoids or fissure. So that visual inspection can tell whether we have other digestive issues that's causing chronic constipation. So another way is obviously there are invisible blood markers, and that can be tested using at-home test that can indicate whether we have other colorectal issues. And some of the over-the-counter blood test kits are the following. Number one is Easy Detect stool blood test. Number two is Hemo Occult Sensa. Number three is Coloscreen. Number four is Immunochemical Fecal Occult Blood Test. And Easy Detect stool blood test and Hemo Occult Sensa is over the counter. You can do it at home. A coloscreen and immunochemical fecal blood tests that needs to be sent to the laboratory, but that still can be done at home at as a much lower cost than other invasive procedures. These are non-invasive ones. When we do these tests, visual inspections or over the counter or laboratory, we can, if you find trace of blood, then that needs to be confirmed by other more invasive or other laboratory test. But again, at home test can give us more indication that whether we have other form of colorectal issues or digestive issues. Best case scenario is that we don't have blood. In my case, it was bright red, so it was because of hemorrhoids and fissures. And when they did colonoscopy, they couldn't find anything as well. There is no bleeding or in my rectum, or there is no bleeding in my large intestines, and and so on. So it was fairly, in the scheme of things, less concerning. But again, blood in stool is always concerning. But this home test can help us detect whether there is visible or invisible blood. And when we find any trace of blood, the wisest decision we can make is contact the healthcare provider and further diagnosis so that we can get a treatment as soon as possible, because our chronic constipation is merely the symptom of more severe diseases. With this, we have come to the end of this chapter, the essential at-home test to get preliminary diagnosis or indication of our causes of chronic constipation. And I want to add a disclaimer here. I have said it again and I'm going to repeat it. These tests are only for information purposes only. These are not the substitute for more clinical medical diagnosis. If you have severe symptoms, abnormal pain, if you have weight loss or see blood, please immediately contact your healthcare provider. This video is only for information purpose only, so that we can help you become scientist of your own body, document your symptoms better, and be educated in understanding the root causes of it, and have a very educated conversation with your healthcare provider. So that's our objective here, not to substitute for clinical advice or medical care. So before we move on to another chapter about listing different clinical tests to confirm the diagnosis of it, because we know that many people suffer from navigating different tests. And as I told earlier in our previous episode, you need to fight like an MMA fighter to get the test done, which may sometimes have to go beyond gastroenterology to a neuropathy or psychology or or endocrine disorders or cardiovascular disorders, so on. So we'll talk about all of those tests, and so that it gives you a more idea that clinical tests are necessary and which test may be the right one for you to get the accurate diagnosis so that you can shorten the path of recovery. So before we go into that, let's quickly summarize 15 at-home tests we discussed earlier. We talk about number one, dietary fiber assessment for low fiber diet. We talk about simple elimination diet for to test for poor dietary habits. We talked about number three, hydration test for lack of fluid intake. Four, keeping a dietary log for caffeine abuse or overuse of alcohol. We talk about doing a medical review to check whether medications are causing our constipation. Number six, keeping a physical activity log for sedentary lifestyle, conducting a temperature test, basal body temperature test for indicating endocrine disorders such as hypothyroidism. We, sensory and reflex check number eight for neurological diseases or neuropathy. We talk about number nine, stress and mental health assessment for psychological issues. Number 10, abdominal massage test for impaired colonic motility. Number 11, we talk about probiotic supplement trial for gut dysbiosis. Number 12, we talk about squatting position during bowel movement to test for defecation disorders. We talk about biofeedback techniques and beetroot techniques. Number 13, to identify pelvic floor dysfunctions. And 14, to make to test for slow transit constipation. We talked about beetroot test and time test with markers. I'm sorry, I have a correction to make in pelvic function disorder. We talk about con- two ways. One is biofeedback technique. Another is contracting and relaxing the pelvic floor muscles, holding the urination. So we talk about that for pelvic floor dysfunction. For 14, for bowel transit time, for slow transit constipation, we talked about beetroot test and capsule marker. And for 15, to identify potential colorectal issues, we talk about home stool blood test. So all of these blood tests are non-invasive mostly, except for the capsule ingest one. But again, that's fairly harmless in comparison to other invasive such as endoscopy, colonoscopy, or sigmoidology. Those kind of tests, and these tests can be done at home. This can educate us immensely about what's going on inside our body and understand these visual biomarkers, physical biomarkers that can help us become scientists of our own body. Because, as I said, most of the chronic constipation we can attribute the cause to our lifestyle, uh, for diet, exercise, nutrition, hydration, and so on. And we can experiment and realize the root cause of it. Then we can take a remedial step. For example, even for pelvic floor dysfunctions, gut motility, we can do at-home exercises at zero cost, which increase our pelvic function control, floor control. For that, we can do Kegel exercises, breathing exercises, and yoga, and so on to increase our control over pelvic floor muscles. So we can do that. So most of, I would say, is self-care. And when we understand these indicators and understand the root causes, we can take our preventative action and we can recover from it. And obviously, there are cases in which it's much more than lifestyle. It can be psychological, neurological, and other digestive disorders. Then to do that, to get a correct diagnosis, we can use this test as a certain indication for education, but that needs to be supplemented at by clinical test. And that's what we are going to talk about next. Stay tuned. Now, let's move on to chapter 3. In this chapter, we're going to talk about the clinical test that are required to diagnose the root causes of chronic constipation. As we know, we may have various different causes of chronic constipation. And for the perfect, I shouldn't say perfect, but for the accurate treatment plan, the accurate diagnosis is super important. And for accurate diagnosis, understanding the clinical test. Again, there are multiple causes, sometimes multivariable causes of chronic constipation. Sometimes it can be very prevalent causes, but at times it can be very rare ones. And also navigating to that particular cause is like walking through a maze. And in order to walk through that maze, obviously we have to be very proactive. And also to make sure we get a very personalized and precise treatment, understanding these clinical tests are extremely important so that we can advocate for it. I have told you before as well, as patients, we have to fight like an MMA fighter to navigate through this maze. In chapter 1, that's exactly why we talk about biomarkers so that we understand what are the biomarkers for diagnosis. And chapter 2, we talk about home test so that we have basic ideas about what's causing it. Now, this is more about clinical test. And we are going to be very comprehensive about this because we understand we may have people who may have a different spectrum of chronic constipation who may be watching, listening to this, or so if you are taking care of someone else, your loved ones or family members, then understanding these different tests may be extremely useful to navigate. And the most important part is shortening the path of recovery. However, I want to add this. This is for information purpose only so that you can be proactive. This is not a substitute for clinical advice. Always discuss these tests and any personalized advice with your with your doctor. So before I go ahead, let me give you a brief overview of this chapter, what we are going to cover. And we are going to have 8 segments, and we're going to talk about 40 plus tests. We are going to organize from simple tests to more comprehensive, simple tests to standard tests to more beyond standard test and test for rare ones. So here are 8 different segments. Number one is segment is clinical. Number one segment is initial screening by general practitioner. So in these, we'll talk about number one, complete blood count. Number two, celiac disease. Number three, fecal occult blood test. Number four, dietary and lifestyle history. Number five, physical activity assessment. Number six, medication review. In segment two, we are going to talk about psychological assessments for constipation. The evaluation include number seven, psychological evaluation and stress assessment. Number eight, behavioral and cognitive assessments. Segment three, we are going to talk about basic metabolic and endocrine assessment. Tests such as number 9, thyroid test, 10, serum potassium levels, serum calcium levels, 12, serum osmolality and urine specific gravity, number 13, blood glucose levels and HbA1c, number 14, vitamin D intoxication, number 15, lead blood level test. In segment 4, we're going to talk about gastroenterologist advanced diagnostic test. 16, extensive stool cultures. 17, SIBO, small intestinal bacterial growth breath test. Number 18, celiac disease biopsy. And segment 5, we are going to talk about specialized motility and structural assessments. Tests include 19, stitch marker test. Number 20, endoscopic procedures such as colonoscopy, gastroscopy, sigmoidoscopy. Number 21, CT scan with contrast. 22, rectal biopsy for Hirschsprung disease. Number 23, full thickness intestinal biopsy. For segment 6, we are going to talk about tests for pelvic floor dysfunction. Tests such as anorectal manometry. 25, defecography. 26, electromyography, EMG. And segment 7, we are going to talk about exploring complex gastrointestinal disorders beyond standard test. And we are going to talk about when to consult cardiologist for tests such as 27, listening to breath sounds. Number 28, mesenteric ischemia testing. Number 29, Doppler ultrasound. And we are also going to talk about the role of rheumatologist, talk about tests such as general autoimmune screening, scleroderma testing, 32, Raynaud's syndrome. And we are going to talk about consulting a neurologist or neurogastroenterologist for neurological underpinnings of GI disorder. We are going to talk about tests such as 33, acid, autonomic gastrointestinal motility, 34, neuropathy examination and nerve condition studies, number 35, intestinal neural null dysplasia diagnosis. And we are going to talk about when to see endocrinologist for endocrine disorders with GI symptoms. We're going to talk about testing from men to multiple endocrine neoplasm type 2. And finally, on segment 8, we're going to talk about miscellaneous test for various causes. 37, blood test for trypanosoma cruzi antibodies. 38, genetic testing. 39, specific allergen test for and elimination diets. 40, serum markers and endoscopy biopsy. 41, antibody test and clinical examination. 42, sweat chloride test and genetic testing. Number 43, anorectal examination and imaging studies. So that's a very comprehensive test because we want to do a comprehensive guide to you so that you can understand everything you need to understand about clinical tests required for diagnosing the root cause of chronic constipation. So let's go one by one. Let's start segment 1. Let's start with our first segment, initial screening by general practitioner. Obviously, our clinical journey begins with our general practitioner, maybe in an annual physical exam, or whenever we have certain symptoms, we generally call up our family doctor, aka our general practitioner. But one surprising fact that I mentioned in our previous episode is that our general practitioner is a general practitioner. The doctor may not be a specialist in GI issues and may not be able to diagnose correctly. However, there are fundamental screenings that GP can order in order to make sure that at least certain causes are ruled out, or at least one prevalent one or simple causes could be diagnosed very easily. So let's go by one. The number one is complete blood count. So which assesses overall health and detect disorders like anemia and infections, which can influence gastrointestinal symptoms such as chronic constipation. And a CBC is a fundamental test that provides a snapshot of our overall health. It can reveal underlying issues such as anemia, which is low red blood cells count, and infection, which is high white blood cell count, and that may contribute to gastrointestinal symptoms like chronic constipation. So CBC measures several components of our blood. Number one, red blood cells. Number two, white blood cells. Three, hemoglobin. Number four, hematocrit. Number five, platelets. So a small blood sample is taken from a vein, typically in our arm. Then the blood is sent to the laboratory for testing, for analysis. And generally, a CBC is often a part of a routine physical examination or order when you have symptoms like fatigue, weakness, inflammation, or infection that could be related to the gastrointestinal issues. So let's get the first blood panel done, which is CBC, and maybe one of those tests will come out positive or lower or higher than we anticipated, and that could help us begin our trial and error understanding and pinpointing the root cause. And number two testing is celiac disease screening. So most of us, not most, but some of may have celiac disease or gluten allergy. And the purpose of celiac disease screening is to diagnose celiac disease, which is an autoimmune trigger condition triggered by gluten. So includes serologic test for anti-tissue transglutaminase antibodies, TTG, IgA, and possibly endomysial antibody test. Celiac disease can cause chronic gastrointestinal symptoms such as chronic constipation, diarrhea, and abdominal pain. And screening helps identify whether gluten or protein found in wheat, barley, rye is triggering the symptoms. And again, it may not be by GP, it can be ordered by the gastroenterologist as well, but it could be one of the initial screenings. So screenings include, again, two parts: anti-tissue transglutaminase antibodies, which is TTG, IgA, or endomysial antibody test. Again, it's done through blood test, and generally this is recommended when there is a persistent gastrointestinal symptom. So for me personally, I did not get tested for celiac disease. The reason why I took the record of my dietary habits, and I did not find any correlation when I eat wheat and my symptoms. So I didn't. It wasn't necessary for me to take it. Or now let's talk about third test, which is fecal occult blood test, which is also initial screening, which detects the hidden blood in the stool, indicating conditions like colon cancer, ulcers, polyps, or colitis. So blood in the stool can be a serious condition, including colorectal cancer, which may not be visible to the naked eye. Early detection to FOBT can lead to timely treatment and better outcomes. And also, blood in the stool also can be because of hemorrhoids, fissures, and so on. Again, depending on the color of the stool, we can determine if it's visible to naked eye. But again, FOBT is for individual through naked eye. Again, it can be done at home or it can be done at lab. So it's typically recommended for individuals over age of 50 as part of the routine colorectal cancer screening for those with unexplained gastrointestinal symptoms. And number four is obviously dietary and lifestyle history. Uh, I also talked about in our home test as well. But again, with your GP, we can go walk through with what are the diets, lifestyles, and we talk about. And then when you keep a record of it, you're able to analyze what's typically causing it, and discussing that with your GP will helpful. And especially when you can talk about stimulants such as alcohol, coffee. We talk about fiber. We can talk about the how you're chewing and so on. Next thing we talk about is fourth thing is physical activity assessment. I told you earlier in at-home test also that sedentary lifestyle can be the cause of it. So you can talk about steps, exercise, and so on that you can measure, and whether how that is correlating with the symptoms, exacerbation. Another one is the medication review. So it detect the medication reviews such as anticholinergics, narcotics, antidepressants, NSAIDs, calcium blockers, psychotropic drugs, iron supplements, bismuth containing medication that can cause constipation. So when you're having chronic constipation, keeping a record when you started the medication, what were the symptoms of it, and discussing that with your GP or gastroenterologist. And then they can obviously do the one of the three things. One, obviously they can talk about the how the drugs is interacting. That's number one. Second is they can obviously discuss the entire medication review with you. Third one is based on the interaction and the review, they can prescribe alternatives or change the doses personalized to your body so that you don't have any chronic constipation as well. Hence, discussing these six initial screenings with your general practitioner will be immensely helpful to diagnose the most common and prevalent causes of it. And obviously, the general practitioner is going to navigate or refer you to the gastroenterologist. And when you go to gastroenterologist, you may have these foundational screenings done, and that can create a baseline for a conversation with your gastroenterologist. So let's move on to section two. We know that there could be psychological factors that can cause chronic constipation. And initially discussing with the general practitioner or with the gastroenterologist, they may be able to refer to the psychologist or psychiatrist to go through the psychological evaluations and assessments. So that can rule out or pinpoint the chronic causes for chronic constipation. So in this section, we have two parts: psychological evaluation and stress assessment, and second is behavioral and cognitive assessments. So let's begin with psychological evaluation and stress assessment. So the purpose is to evaluate stress levels, anxiety, depression, and psychological factors that may contribute to constipation. Because psychological factors such as stress, anxiety, and depression can significantly impact gastrointestinal function. High stress level can lead to muscle tension and altered gut motility, which again contributes to constipation. So this evaluation includes mental health through standardized questionnaire and interviews to identify the levels of stress, anxiety, and depression. So that's why we also recommend to keep a record of your mood, stress, and anxiety level so that the more data you have, and then there is an exacerbator of symptoms, it's easier to pinpoint when was the exact start date and the level of severity of that particular symptoms. So this is conducted two ways. One is standardized questionnaire. You may be asked to fill forms such as the big depression inventory or generalized anxiety disorder scale. So in my annual visit, they ask for this standardized questionnaire for a depression screening. And second is clinical interviews, or psychologist or psychiatrist conducts in-depth interviews to understand your mental health status and identify psychological issues affecting your gut health. Again, this assessment is conducted if you're a general practitioner, suspect that there are psychological factors, or also gastroenterologists suspect that there are psychological factors that might be contributing to constipation, or if you have the history of mental health or uh, psychological health. Now, let's talk about behavioral and cognitive assessments. The purpose of this assessment is to identify behavioral patterns and cognitive issues that might affect the bowel habits and gut health. Because behavioral and cognitive patterns such as poor eating habit, lack of exercise, negative thoughts about bowel movements can contribute to chronic constipation. Understanding these patterns can help in developing strategies to improve gut health and alleviate chronic constipation. So, this assessment involves analyzing daily habits, behaviors, thought processes related to eating, physical activity, and bowel movements. So, this is done to two ways. One is behavioral analysis. What you do is you keep a diary of documenting your daily routines, eating habits, physical activity, and bowel movements. Second is cognitive assessment. A psychologist may use cognitive test therapy techniques to identify and address negative thoughts, patterns, and behavior affecting your gut health. So, behavioral health assessment and cognitive assessment are recommended if your lifestyle changes and initial medical treatments do not alleviate constipation. That indicate that there is a deeper psychological factors may be involved. So, it may be recommended by your GP or your gastroenterologist. Again, understanding psychological factors contributing to chronic constipation is crucial for comprehensive treatment, the personalized treatment, and psychological assessment in managing chronic constipation is essential, useful to rule out and pinpoint the psychological reasons. With this, let's move on to the segment 3. Now let's move on to our segment 3 of this chapter, which is about basic metabolic and endocrine assessments. Your doctor might look into metabolic and endocrine causes with these tests. So number 9 is thyroid function test. The purpose is to rule out thyroid function, which affects gut motility. Hypothyroidism, for example, can cause constipation. The thyroid gland plays a crucial role in regulating metabolism. Thyroid function, especially hypothyroidism, can slow down metabolism and gut motility, leading to constipation. So thyroid function typically include thyroid stimulating hormone TSH levels and free thyroxine, free T4 levels. A blood sample will be taken to measure the levels of TSH and free T4. So low TSH and high free T4 indicate hyperthyroidism, which is less common but can lead to rapid bowel movement or diarrhea. While high TSH and low free T4, hypothyroidism commonly slows down the gut motility and leading to constipation. So in this scenario, if there is a thyroidism is causing constipation, getting this test done can help identify these root causes. So always ask your doctor and discuss with your doctor to test these if you think hypothyroidism or is the causing your constipation. Now let's move on to another test, 10, serum potassium level. The purpose is to diagnose hypokalemia, a condition with low potassium levels affecting bowel movements. Potassium is essential for normal muscle function, including the muscles of the digestive tract. Low potassium levels, hypokalemia, can impair muscle contractions in the intestines, leading to constipation. A serum potassium test measures the amount of potassium in the blood. Obviously, a blood sample is taken in the lab and analyzed to determine the potassium levels. So low potassium level hypokalemia can cause weakened muscle contractions, including in the intestines, that leads to constipation. And high potassium hyperkalemia, which is less commonly related to constipation but can cause muscle weakness and fatigue, potentially impacting overall health. So low potassium level can cause weak muscle contractions, and obviously muscle contractions are important for sterolysis and pass the stool in the from the large intestines to rectum. So if you think your potassium level is causing it, please consult a doctor and get this test done. Now, number 11 is serum calcium level. This also detects hypocalcemia, where elevated calcium levels can cause to constipation. And obviously, calcium is a vital for various bodily functions, like potassium for muscle contraction. And the elevated calcium levels, hypercalcemia, can reduce gut motility, which causes constipation. A serum calcium test measures the amount of calcium in the blood. Similarly, it's a blood test, and the low level hypocalcemia, not commonly linked to constipation, but can cause muscle spasms and cramps. And high calcium hypercalcemia leads to reduced gut motility and constipation due to increased muscle relaxations. So these things can cause potassium, and both calcium potassium low levels and calcium high levels can cause gut motility and lead to constipation. Now let's talk about 12, serum osmolality and urine specific gravity. The purpose is to diagnose diabetes insipidus by evaluating low urine specific gravity and high serum osmolality. So, diabetes insipidus affects the body's ability to regulate fluid balance, leading to excessive thirst and urination, which can impact bowel movements. So, serum osmolality test measures the concentration of particles in the blood, and urine specific gravity test measures the concentration of particles in the urine. For serum osmolality, a blood sample is taken, while for urine specific gravity, a urine sample is collected. So, low urine specific gravity and high serum osmolality, which is diabetes insipidus, leads to dehydration, which can cause constipation. As we talked earlier as well, when body is dehydrated, the intestines pull the water from the stool and making the stool harder and making it difficult to pass to the large intestine. So dehydration can be caused by diabetes insipidus, which can relate to constipation. So if you think your diabetes insipidus is causing your constipation, you can ask and discuss about this test with your doctor. So another test we're going to talk about is blood glucose level, which is number 13, blood glucose levels and HbA1c. This purpose is to diagnose diabetes mellitus by evaluating the blood sugar levels. So high blood sugar levels, hyperglycemia, can lead to nerve damage and reduce gut motility, causing constipation. So two tests, blood glucose test measures the current level of glucose in the blood, and HbA1c test measures the average blood glucose levels over the past 2-3 months. So blood glucose level, a blood sample is taken, even for HbA1c, a blood sample is taken to measure the percentage of hemoglobin coated with sugar. And for blood glucose test is often after fasting. So there are two, fasting and after fasting. So impact of levels and constipation is low blood glucose level, hypoglycemia is generally not linked to constipation, but can cause generally weakness and fatigue, while high blood glucose, hyperglycemia, can lead to neuropathy, nerve damage affecting the intestines and slowing down the gut motility, which results in constipation. Again, even think diabetes mellitus is causing your constipation, request or discuss with your doctor to get this test done. Next, number 14 is vitamin D intoxication test. So, which again, low vitamin D and high vitamin D can impact the constipation. And here is how. So, low vitamin D can cause an inflammation, so that can also cause constipation, whereas excessive vitamin D can lead to hypercalcemia, which can in turn cause constipation. So in order to test this, our serum 25 hyperoxyvitamin D measures the amount of vitamin D in the blood. Again, the blood sample is taken, and low levels, I said earlier, is often linked to poor muscle function and gut inflammation, which can contribute to constipation. And high vitamin D levels leads to hypercalcemia, causing reduced gut motility and constipation. So both high and low both can cause constipation. And vitamin D deficiency is quite common around the world. Uh, the reason behind that is most of us are indoors all the time. We don't go out much, and the major source of vitamin D is the sun. Therefore, we are not getting enough sun. Especially, there is more risk to people who live in the northern or who is close to northern poles or southern poles, because of sun rays. There isn't enough ultraviolet rays that reach that part of the region, and vitamin D is deficient for most people. For example, I live in New England area where winters are longer, and I do not get enough vitamin D through sun because it's short summer and long winter. I mean, in summer it's extremely hot, so we rarely go out. Then how do I make sure that I have sufficient vitamin D? So there are two sources, obviously food, and food such as milk or salmon and so on can get some vitamin D, but generally insufficient. So what I resort on is taking a vitamin D supplement. And that's where, while taking the vitamin D supplement, we have to be careful because excessive vitamin D or excessive vitamin D intoxication, as I said earlier, can lead to hypercalcemia, which can cause constipation. So always it's better to and monitor. So it doesn't have to be that frequent, maybe annually and so on. We can measure it. And if you think vitamin D deficiency is causing constipation, you can always request to get tested. It doesn't even have to be done by gastroenterologist. I think you can discuss that with your general practitioner and get this tested. I got tested. I had low vitamin D and started taking vitamin D supplements. After that, I did multiple things, but getting the right vitamin D level also contributed in giving me relief from chronic constipation. Now let's talk about the last one in this segment, which is lead blood level test. So lead blood level test detects the lead poisoning, which can cause constipation. Obviously, lead poisoning can affect multiple bodily systems, including the gastrointestinal tract, leading to symptoms like abdominal pain and constipation. And a lead blood level test measures the amount of lead in the blood. And obviously, it's done in the lab. The blood sample is taken, in a low, so impact of levels on constipation. Low lead levels, normal levels do not impact constipation, while high lead poisoning can cause gastrointestinal symptoms, including abdominal pain and constipation. So these are the tests that we talk about in the basic metabolic and endocrine assessment. Thyroid function test, serum potassium levels, serum calcium levels, serum osmolality and urine specific gravity, blood glucose levels, HbA1c, vitamin D intoxication level, and lead blood level test. Again, it's important to know that this is for information purposes only, and I think for personalized advice and personalized treatment plans and personalized root causes, it's important to discuss these tests with your doctor. And if a doctor is not prescribing, perhaps being proactive and advocating for their own health and listing these tests and getting this test done, because most of these tests are fairly inexpensive and compared to the other very invasive procedures. So I think ruling out these endocrine and metabolic causes would be really beneficial, either to pinpoint the root cause, or rule out the possible causes of these. So always consult this with your doctor. And next, we have completed the basic test, which can be either done by the gastroenterologist or primary care doctor, or even there is a referral for the psychological assessment to psychologist or psychiatrist. And now let's move on to the more advanced diagnostic test, which will be run by or prescribed by gastroenterologist. Now moving on to segment 4, which is gastrologist advanced diagnostic test. They might perform these tests to get more detailed perspective or picture of your gastrointestinal health. We'll talk about 3, and obviously following the series that we have been talking from previous segments as well. Number 16 is comprehensive stool cultures. Number 17 is SIBO, small intestinal bacterial growth, and 18, celiac disease biopsy. Now first, let's talk about comprehensive stool cultures. So comprehensive stool cultures are recommended if you have persistent gastrointestinal symptoms like diarrhea, or constipation or abdominal pain that do not respond to initial treatments. And if you have traveled to the areas with known gastrointestinal pathogens. The purpose of this test is to detect pathogens not identified in standard test and is useful for diagnosing infections causing diarrhea, constipation, and abdominal pain. The standard stool test may miss certain pathogens that cause gastrointestinal symptoms. Comprehensive stool cultures help identify broad range of bacteria, virus, and parasites that could be causing issues such as chronic diarrhea or abdominal pain. So, comprehensive stool cultures target a wide variety of pathogens, including bacteria, Clostridium difficile is also known as C. difficile, Salmonella, Shigella, Campylobacter, Escherichia coli, common known is E. coli, viruses such as rotavirus or norovirus, and parasites such as Giardia, Entamoeba histolytica, Cryptosporidium. And these tests are done through through a stool sample. You will be provided with a sterile container to collect a stool sample at home, and it is then sent to laboratory to get the test. In the laboratory, where it is cultured to identify any pathogenic microorganisms. So additional tests such as PCR, polymerase chain reaction, may be used to detect specific viruses and parasites. Obviously, the best case scenario we are looking for is no pathogenic microorganism detected, while you it is a test which has a minimum discomfort because it's just about taking a stool sample and setting that to laboratory. It's very non-invasive, and obviously you may require follow-up test with specific pathogen PCR test if the stool culture tests are inconclusive. And this is how gastroenterologists can decide whether bacteria, virus, or pathogens are causing your chronic diarrhea, abdominal pain, or chronic constipation. And next, we have the SIBO breath test. SIBO meaning small intestinal bacterial overgrowth breath test. So this test, the SIBO breath test, is recommended if you have symptoms of bloating, diarrhea, and nutrient malabsorption that suggest bacterial overgrowth in the small intestine. So SIBO occurs when excessive bacteria grow in the small intestines. So this helps confirm the presence of bacterial overgrowth. The SIBO test measures the levels of two main gases in our breath, one hydrogen and two methane. So elevated levels of these gases indicate bacterial overgrowth in the small intestine. Lactulose or glucose are sugars that are not normally absorbed in the small intestine. If bacteria are overgrown, they ferment these sugars, producing hydrogen and methane. Let me repeat. Lactulose or glucose are the sugars that are not normally absorbed in the small intestine. If the bacteria are overgrown, they ferment on these sugars, lactulose or glucose, and then produce hydrogen and methane. So elevated levels of hydrogen typically indicate small intestinal bacterial overgrowth, and also elevated levels of methane can suggest colonic bacterial overgrowth or archaea overgrowth, which may cause constipation rather than diarrhea. So methane is the culprit in the colonic bacterial overgrowth. For this test, you will need to follow a specific diet for 24 hours before test and fast for 12 hours before the test. Basically, you will be drinking a sugar solution, usually lactulose or glucose, then provide breath samples at regular intervals over a few hours. Then the breath samples are analyzed for hydrogen and methane levels. Elevated levels, as I mentioned earlier, indicate bacterial fermentation of the sugar solution in the small intestine. And the best case scenario we are looking for is a normal results with low levels of hydrogen and methane. And this can have mild discomfort because it's about 12 hours of fasting and drinking a sugar solution. If you ask me, I fast for 16 hours, not a problem at all. But again, some people may not be used to fasting, so for them it will be mild discomfort. And these days there are newer and non-invasive breath tests for SIBO being researched, though endoscopy with bioscopy remains the gold standard for more detailed diagnosis. But again, breath tests can be done to diagnose whether your small intestinal bacterial growth is causing your intestinal health. So if you have these kind of symptoms, please consult with doctor, or if you are not getting these tests done, you can ask for it. As I mentioned ago, always advocate for test. And you know your health better than anybody else if you have been keeping a detailed record of your symptoms, what you eat, and then analyze and correlate between what you eat, what you do, and your gastrointestinal symptoms, you'll be able to have a very general direction about what's causing it. And based on that particular general direction, you can discuss with your healthcare provider. And another one which we want to talk about is number 18, celiac disease biopsy. So this is when it is recommended if you have a positive serologic test for celiac disease, such as TTGIGA, which you talk about in the biomarkers as well. So it is a blood test, and if the marker is up, then it's indication for celiac disease, which is autoimmune condition reacting to the gluten. And the symptoms you may have is chronic diarrhea, abdominal pain, and nutrient deficiencies. That can suggest celiac disease or other inflammatory conditions. So this celiac disease biopsy is taken during endoscopy to diagnose conditions like not only celiac disease, but also other such as eosinophilic gastroenteritis and microscopic colitis. Obviously, a biopsy is a gold standard for diagnosing celiac disease, which is an autoimmune condition triggered by gluten. And it can also help diagnose other conditions we mentioned earlier about eosinophilic gastroenteritis and microscopic colitis. Again, it's crucial to be on a gluten containing diet before the test for accurate results, as a gluten free diet can normalize the small intestinal lining, leading to false negatives. And again, keeping a detailed record of containing of gluten containing food and also your gastrointestinal symptom and mapping what you eat with what your symptoms can also give you a general indication that gluten may be causing your chronic constipation or digestive distress. And these blood tests for celiac disease and biopsy are to confirm whether these celiac disease is the root cause of your chronic constipation or gastrointestinal disorder. So with this, we have come to the end of segment 4. Now, we are going to more specific ones because we may also have other causes for chronic constipation. Segment 5, we are talk about specialized motility and structural assessments. Let's look at some specialized tests that assess the motility and structure of gastrointestinal tract. So we are going to talk about the following test: switch marker test, endoscopy procedures, CT scan with contrast, rectal biopsy for Hirschsprung disease, full thickness intestinal biopsy. First, let's look at number 19, switch marker study. A switch marker study is typically recommended if you have symptoms for chronic constipation and other tests have not determined the cause. The purpose of this study is to assess the colonic transit time by tracking radio-opaque markers through the colon. This test helps determine how quickly or slowly materials move through the colon. It is especially useful for diagnosing slow transit constipation. You swallow capsules containing radiopaque markers that can be seen on x-rays. For this one, no specific preparation is required. You will swallow a capsule containing markers, and over the next few days, x-rays will be taken in specific intervals, typically on days 1, 3, and 5, but the exact schedule may vary depending on the facility. Then the x-ray will show how long it takes for the markers to travel through the colon. And obviously, the normal result is markers pass the colon with the normal transit time. And you may have potentially minimum discomfort as it involves swallowing a capsule and undergoing x-rays. For this, non-invasive tests for GI motility are being developed, but the switch marker study remains a reliable method. If the results are inconclusive, further motility tests like colonic manometry may be recommended. So this switch marker study is to determine whether you have slow transit constipation. And if the capsule is taking longer to go through, then that means your gut motility is slow. And that's how study is useful to pinpoint whether slow transit constipation, whether gut motility is causing slow transit constipation. Next, let's discuss endoscopy procedures, which include colonoscopy, gastroscopy, and colonoscopy and gastroscopy procedures are usually recommended if you have symptoms like persistent abdominal pain, unexplained weight loss, chronic diarrhea, or blood in your stool. So this allows direct visualization of gastrointestinal tract to assess for inflammatory and bowel diseases tumors, ulcers, and structural abnormalities. These procedures can also be used to collect biopsies during the examination. So these procedures are essentials for diagnosing wide range of gastrointestinal conditions from colorectal cancers to Crohn's disease. So what is colonoscopy? It's about examining the entire colon. For gastroscopy is examining the esophagus, stomach, and first part of the small intestine. For preparation required, so fasting and bowel preparations are required to clear the intestines. Typically involves drinking of polyethylene glycol solution to cleanse the bowel. So we have talked deeply about colonoscopy because colonoscopy is one of the important invasive test mechanisms in the US and all over the world. In the United States alone, there are 16 million colonoscopies that happen in a year. So we created the entire playlist that goes from T minus 14 days to T plus 1 days, where T being the colonoscopy date. So there is a various preparation process. And we also learned that because of the inadequate preparation, there is a lot of cancellation, about 23% to 30% of the cancellations and rescheduling. And even when the colonoscopy procedure is gone, the it's inconclusive because of the inadequate preparation. So in order to resolve that, we have done two things. One, we have created an extensive preparation playlist. If you are going through colonoscopy, please go through that. We are going to link in the description, and you can find it in the GutSphere channel as a colonoscopy preparation timeline playlist. It's a podcast, it's a video podcast. You can find it on Spotify and YouTube as well. So, and we also talk about different kinds of preparation solutions based on your existing conditions, based on your budget. We will be able to identify what's the right solutions for you. And also, when you go through this, which we have also learned that many people postpone the colonoscopy because of the anxiety. And I think, yes, anxiety is understandable, but when you understand what really goes into it, I think you can actually get through without exacerbating your anxiety. So colonoscopy is done when through a physical tube with a camera, which is called colonoscope, is inserted through a rectum to visualize the colon. The procedure usually takes 30 to 60 minutes. In the United States, you will be under sedation. I had gone through colonoscopy. I was sedated and I didn't feel a thing. For gastroscopy, a similar tube endoscope is inserted through the mouth to visualize the upper GI tract. The procedure usually takes 15 to 30 minutes. I went through that, but there was no sedation available. It was mild discomfort because typically fasting is required. So in comparison between colonoscopy and gastroscopy, colonoscopy requires more preparation than the gastroscopy. After this, a doctor can take biopsies, remove polyps, and examine any abnormalities during the procedure. Obviously, the normal result that we're expecting for is healthy tissue with no signs of disease or abnormalities. When I went to colonoscopy, they found some polyps, and they sent to a lab. It was benign, and I'm glad that at least some polyps were removed. For gastroscopy, they found that I had gastritis, and prescribed me the antibiotics to kill the H. pylori bacteria, which is causing some gastritis. Again, for colonoscopy, you may get a mild discomfort. Uh, the discomfort is a little bit higher for colonoscopy because preparation is longer, fasting period is longer. You have to prepare for multiple days in advance, such as low residue diet, liquid diet, and fasting, no liquid at all. But for gastroscopy, the preparation is relatively minimum in comparison to colonoscopy. Maybe in the future, or as we talk about, there are non-invasive options such as virtual colonoscopy or capsule endoscopy are available, but they have limitations. But still, the gold standard is colonoscopy and gastroscopy, which is also called endoscopy. And if this is inconclusive, then the gastroenterologist will prescribe more imaging tests or biopsies based on the initial findings. The next is we're going to talk about sigmoidoscopy. So sigmoidoscopy is usually recommended for routine colorectal cancer screening or if you have any symptoms like rectal bleeding or changes in the bowel habits. So difference between the sigmoidoscopy and colonoscopy is that colonoscopy is used for entire large intestine, but the sigmoidoscopy is only for your rectum area. It's minimally invasive of the sigmoid colon to detect issues such as inflammation, ulcers, polyps, and cancer. Sigmoidoscopy is less invasive than a full colonoscopy and can be used as a screening tool for colorectal cancers and other lower GI tract issues. Similar to colonoscopy, a flexible tube with a camera, sigmoidoscope is inserted through the rectum to examine the lower part of the colon. Similar to colonoscopy, fasting and bowel preparations are required. The sigmoidoscope is inserted through the rectum to visualize the sigmoid column. That the procedure usually takes 10-20 minutes, and the doctor can analyze, take biopsies, remove polyps, and examine any abnormalities. Obviously, the normal result we are looking for is healthy tissue with no signs of disease or abnormalities, and potentially discomfort. It's less discomfort compared to a full colonoscopy with mild cramping or bloating during the procedure. For sigmoidoscopy, sedation is optional. And obviously, if abnormalities are found, a full colonoscopy may be recommended for more comprehensive examination. So, sigmoidoscope is a lower rectum, which is minimally invasive. Colonoscopy is more invasive, and the endoscopy is for the upper GI tract. These are the endoscopy procedures that's going to help evaluate the structural assessments and specialized motility and more diseases that gastroenterologists are going to use to pinpoint the root cause or rule out. And if you are not getting any of these tests, please consult with the doctor. And one more thing which I want to add is based on your insurance, the cost may be variable. I have created a comprehensive deep dive about navigating the healthcare system so that you have to spend less and how to maximize a doctor's visit and so on. I'll link to that video. Please watch it. That's very, very important information because as chronic constipation patients or as chronic GI patients, we visit our doctors and we use insurance a lot, and and there is a financial burden or financial stress that's going to creep up, and being smart to navigate the financial concerns, how to talk to insurance companies, how to get this test done. And the short magical word is it is medically necessary, and if you use it and you request your doctors to use it, then you may get this test prescribed for you at insurance cost instead of being labeled as experimental. Next, we have CT scan, which is number 21, CT scan with contrast. A CT scan with contrast is usually recommended if other tests like endoscopy are inconclusive and if there is a need for further investigation because of suspected tumors or obstructions. So CT scans with contrast provides detailed images to identify obstructions, tumors, and other abdominal abnormalities. So this test is reserved for when other tests are inconclusive because of the radiation risk. So CT scans offer cross-sectional images of the abdomen, making it easier to identify structural problems and other tests that might miss. The contrast dye improves the visualization of blood vessels and soft tissues within the abdomen. A CT scan with contrast involves using a special dye to enhance the image of the abdominal regions. So preparation, you may need to fast for a few hours before the scan. The contrast dye can be ingested orally or injected intravenously. You lie on a table that slides into a CT scanner. The scanner takes multiple X-rays images from the different angles, and the radiologist analyzes the images to identify any abnormalities. And one important note is people with allergies to contrast dyes should inform the doctor beforehand. And the normal result that we want is no obstructions, tumors, or structural abnormalities detected. And obviously, it is the mild discomfort from fasting and contrast dye, which can cause a warm sensation. The procedure involves exposure to ionizing radiation. So alternatives or follow-ups like if any abnormalities are found, further imaging test or biopsy may be recommended. So next, let's discuss the rectal biopsy for Hirschsprung disease, which is number 22, rectal biopsy for Hirschsprung disease. This is recommended. A rectal biopsy is recommended if a child has symptoms of chronic constipation and other signs that suggest Hirschsprung disease. So, Hirschsprung disease is a congenital condition that affects bowel movement, which diagnoses and purpose of rectal biopsy for Hirschsprung disease is to diagnose Hirschsprung disease where nerve cells are missing in part of the colon. A small tissue is taken, a biopsy is taken, which is a definite way to diagnose it by checking for the absence of nerve cells. A small tissue sample is taken from the rectum to look for the nerve cells. For this, no special preparation is usually needed. A small piece of tissue is removed from the rectum using a biopsy tool. This procedure is normally performed on infants or young children, and the tissue is examined under a microscope for a presence of or absence of nerve cells. So this test usually, if the infant or the children have constipation, then Hirschsprung disease, which is a congenital disease with a lack of nerve cells in the colon, would be the suspected root cause. Then this test is advised for that. And also, if you have been having this chronic constipation since childhood, then maybe some doctors may recommend you can always discuss about these rare conditions with your gastroenterologist. And the discomfort level is very mild or slight bleeding at the biopsy site. In some cases, the imaging test may be used to diagnose Hirschsprung disease, although a rectal biopsy is still considered the most accurate method. And one more thing which I want to add for the endoscopic procedure is there may be a small bleeding because of the perforation. For example, when you're some gastroenterologist remove the polyps, then there may be a small bleeding, and that may cause some bright red stool or some bleeding from the rectum, and that will go away. And if that doesn't go away, you should definitely contact your doctor when you go through this test. Now, number 23, if we are talk about the full thickness intestinal biopsy. A full thickness intestinal biopsy is usually recommended if there are severe motility issues that are not explained by other tests. So this diagnoses conditions like pseudo-obstructions and intestinal neuronal dysplasia. So these conditions involve abnormalities in muscles or the nerves of the intestines, which can cause severe motility issue. A full thickness biopsy provides a comprehensive view of the intestinal wall. So a full thickness sample of the intestinal wall is taken to examine the muscles and nerves. For fasting may be required before the procedure, and the biopsy is usually taken during an open or laparoscopic surgery. This is a more invasive procedure compared to other options. The tissue sample is analyzed under a microscope to identify any abnormalities in muscles or nerves. And obviously, to rule out, we want a normal result, normal muscle and nerve structures in the intestinal wall. And there is slight discomfort related to the surgical procedure and the recovery time. And obviously, further test or surgical treatments may be recommended based on the biopsy result. So these are the specialized motility and structural assessments for gut motility issues. They are invasive tests, non-invasive tests. This is mostly invasive test, and mostly it also requires surgery or going to the health system. So facility is more expensive, and we have to be careful because about the cost, because some of them may be covered by the insurance or may not be covered by the insurance. So one typical advice is get pre-approval, shop around, and again, let me remind you this: I have created a very comprehensive video about how to navigate the healthcare system. Please watch the video. The link is mentioned in the description. And again, most of these tests, maybe your gastroenterologist may prescribe you, or if you're not getting tested and you suspect any of diseases, you can always discuss with your the doctor for personalized advice and personalizing the treatment plans. Next is we are going to move on to segment 6. We are going to talk about another very specific conditions that can cause chronic constipation, which is pelvic floor dysfunction. And we are going to talk about different tests to diagnose pelvic floor dysfunction. Pelvic floor dysfunction can also contribute to constipation. Now we are going to talk about tests to confirm pelvic floor dysfunction. Requires specific tests that assess the function and the coordination of pelvic floor muscles. Here are some of the key tests: defecography, 26, electromyography. First, let's talk about anorectal manometry. Anorectal manometry is typically recommended if you have symptoms of chronic constipation, difficulty with bowel movements, or if other tests have not determined the cause of your symptoms. So this measures the pressure of anal sphincter muscles, rectal sensation, and neural reflexes. This test helps to evaluate how muscles and nerves in the rectum and the anus are working together. It is especially useful for diagnosing conditions like dyssynergic defecation, where there is an inability to relax the anal sphincter during bowel movements. A small flexible tube with a balloon at the end is inserted into the rectum to measure the muscle pressures and sensations. So for preparation, you may need to perform a bowel prep, which typically involves using a laxative or enema to clear the rectum. You lie on your side. A small flexible tube with a balloon at the end is gently inserted into the rectum. The balloon is inflated and the measurements are taken as you contract and relax your anal sphincter muscles. The test also measures how your rectum responds to pressure and sensation. The procedure usually takes around 30 minutes, and the doctor will analyze pressure readings and sensations to assess the function of the muscles and nerves. So, normal results are normal muscle pressures and coordinated reflexes. You may have a mild discomfort during the insertion of tube and balloon inflation, and if abnormalities are found, further test or treatment like biofeedback therapy may be recommended. So this test is helpful in figuring out whether you have pelvic floor dysfunction. Now, next, let's discuss defecography. So defecography is usually recommended if you have symptoms of chronic constipation, incomplete bowel movements, or if there is suspicion of pelvic floor dysfunction. So an imaging that tests the evaluation of the function of rectum and pelvic floor dysfunction during defecation. So this test helps visualize the process of defecation and identify any structural abnormalities or dysfunctions in the pelvic or pelvic floor muscles and rectum. So an imaging technique often using fluoroscopy, real-time X-ray, or MRI to observe the rectum and pelvic floor during the simulated defecation. You may need to perform a bowel prep similar to anorectal manometry to clear the rectum. So you will be given a thick barium paste to insert into the rectum, which acts as a contrast material for imaging. You'll sit on a special commode with the imaging suit, and imaging will be conducted as you try to expel the barium paste. The test typically takes around 30 to 45 minutes. The doctor will analyze the images to assess the movement and coordination of pelvic floor muscles and rectum during the defecation. So normal result is proper coordination of pelvic floor muscles, normal expulsion of the contrast material. Obviously, you'll have a mild discomfort during the insertion of the barium paste and while expelling it. And if abnormalities are found, for the test or treatment like pelvic floor, physical therapy may be recommended. Next, and the last one to diagnose pelvic floor dysfunction, let's talk about electromyography or EMG. So EMG is typically recommended if you have symptoms, obviously, of chronic constipations, unexplained pelvic pain, or suspected pelvic floor dysfunction. And this assesses the electrical activity of the pelvic floor muscles to identify abnormalities in muscle function. So this test helps diagnose neuromuscular disorders that can affect the pelvic floor muscles, contributing to the chronic constipation and other pelvic floor dysfunctions. So it can identify conditions such as pudendal neuropathy, where there is a damage to the pudendal nerve that controls the pelvic floor muscles. So small electrodes are used to measure the electrical activity of the pelvic floor muscles. So for this, no preparations are required. Small adhesive electrodes are placed on the skin and anus, around the anus, or a small probe with electrodes is inserted into the rectum or vagina. The electrodes measure the electrical activity of the pelvic floor muscles while you contract and relax them. The procedure usually takes around 30 minutes, and the doctor will analyze electrical activity to assess muscle function and coordination. Obviously, the normal results is normal electrical activity and proper muscle function, and you may have minimal discomfort during the placement of electrodes or insertion of the probe. Obviously, if abnormalities are found, further tests or treatments like neuromuscular therapy or biofeedback may be recommended. So these three tests can confirm whether you have pelvic floor dysfunction: anorectal manometry, defecography, electromyography. Generally, there is a symptom that you have pelvic floor dysfunction is you have the urge to go, but it doesn't come out. And that in that scenario, you can actually ask for a request or discuss this thing with your doctor. And obviously, you can exercise uh, pelvic floor muscle exercises. You can do biofeedback therapies at home or with your specialist in order to recover from pelvic floor dysfunction. These tests for pelvic floor dysfunction provide a crucial information about the function and the coordination of muscles and nerves involved in defecation. So, identifying the root cause of your symptoms allows for a more targeted and effective treatment. While some of these tests may be uncomfortable, they're generally well tolerated and is vital for diagnosis. So always consult with a doctor to determine whether these tests are needed or which test is more appropriate for your situation. Next, we are going to talk more about complex gastrointestinal disorders, and that go beyond standardized test. We know the root causes for different cases, maybe different person may be different, and there may be non-gastrointestinal issues that may be causing chronic constipation, and we'll talk about those in segment 7. Now let's move on to our 7th segment, in which we'll talk about exploring complex gastrointestinal disorders beyond standard test. As we know, GI issues can be quite complex and multidisciplinary. And after we have gone through series of standard tests which gastroenterologists will run, and most of the times we have to ask for it, request for it, and discuss with it. So there are some cases in which it's very peculiar and it may go beyond the standard gastrointestinal disorders. And this is where we're going to talk about other functions such as cardiology, rheumatologist, neurologist, and also endocrinologist. We will need to or rule out these conditions as well. And if we haven't been diagnosed from the earlier test, maybe these are the options you should explore and discuss with your gastroenterologist so that they can recommend you to other specialists. So let's go one by one and let's start with cardiologist. So when to consult a cardiologist? You may want to see a cardiologist if you're experiencing severe abdominal pain, or you have undigested or unexplained digestive issues, or if there is a suspicion that vascular problems are contributing to your GI symptoms. So we're going to talk about 3 tests. Number 27, listening for brute sounds. 28, mesenteric ischemia testing, and Doppler ultrasound. So let's start with listening for brute sounds. This indicates vascular narrowing that may impair intestinal blood flow. So brute sounds are abnormal sounds heard through a stethoscope, indicating turbulent blood flow due to narrowing or blockage in venous vessels. So doctor uses a stethoscope to listen to the blood flow sounds in the abdomen. For this, there is no preparation required. That the doctor will simply place a stethoscope on the abdomen to listen for any abnormal sounds. So the presence of brute sounds indicate potential vascular narrowing. So obviously we want a normal sounds, no abnormal sounds detected, and there is non-potential discomfort because it's a non-invasive and is simply a painless procedure. And if a brute is detected, for the imaging tests like Doppler ultrasound or mesenteric angiography may be recommended. So now let's move on to number 28, mesenteric ischemia testing. So if you have severe abdominal pain after eating, that may indicate possible blood supply failure to the bowels. So the purpose of this mesenteric ischemia testing is to check for blood supply failure to the bowels, which is causing severe pain and digestive problems. So mesenteric ischemia occurs when a blood flow to the intestines is restricted. And obviously this will lead to pain and potential digestive issues. So this involves various testing such as mesenteric angiography, CT angiography, or Doppler ultrasound. So for this process, fasting may be required before certain imaging test. And depending on the test, you may receive an injection of contrast dye to highlight the blood vessels. And the image will show any blockage or narrowing in the mesenteric arteries. And the normal result is normal blood flow through the mesenteric arteries. And you may have a mild discomfort because from fasting, and if the injection is required from the contrast dye, from that you may get a mild discomfort. Other than that, I think it should be a fairly simple process. So after the test, the treatment options may include angioplasty, stenting, or surgery if mesenteric ischemia is confirmed. The third test which you can request or you can discuss with cardiologist is Doppler ultrasound. And if there is suspicion of mesenteric artery abnormalities or wall thickening affecting bowel function, this is also the advanced way of assessing mesenteric arteries for abnormalities or wall thickening affecting bowel function. So Doppler ultrasound measures the blood flow and can detect abnormalities in the mesenteric arteries. This is how it's conducted. An ultrasound device uses sound waves to visualize the blood flow in the mesenteric arteries. For this, no specific preparation is required. A gel is applied on the abdomen and a handheld device transducer is moved over the area to capture images. The images show blood flow and any abnormalities in the mesenteric arteries. And obviously, normal result is normal blood flow with no abnormalities or wall thickening. Essentially, it is very minimal discomfort from the pressure of the transducer on the abdomen or some cold sensation because of the gel. So if the abnormalities are found for the test, like angioplasty or surgery may be recommended. So these three tests from the cardiologist can also explain the blood flow in the abdominal area and confirm that that is not causing the gastrointestinal distress. And obviously, if all the tests are done and the diagnosis is not possible to rule out the vascular problems, is important to see the cardiologist, and you can discuss that with your gastroenterologist. Next, let's talk about when to see rheumatologist. You may want to see a rheumatologist if you have unexplained GI symptoms that may be linked to an autoimmune condition. So if you have unexplained GI symptoms and there is a symptom of a systemic autoimmune conditions, that's when you want to go and see rheumatologist, at least discuss autoimmune conditions with your gastroenterologist and then ask or request to see rheumatologist. So in this one, we're talking about three different tests. Number 30 is general autoimmune screening. 31 is scleroderma testing. Number 32, Raynaud's syndrome. So let's go one by one. Let's start with 30th testing, which is general autoimmune screening. So general autoimmune screening identifies systemic autoimmune conditions affecting the GI tract. We already talked about the celiac disease, which is also an autoimmune condition which is triggered by gluten. So that can be part of this general autoimmune screening as well. So in this one, which happens is autoimmune conditions can cause various GI symptoms and that need to be identified for proper management. For this, a blood test is done to detect antibodies indicating autoimmune diseases, and it will run through a panel of tests. And the blood sample will be analyzed for antibodies. And you don't need to do any preparation for this. It's simply a blood test. And the normal result we expect is antibodies, no antibodies detected. There is no discomfort at all unless you're scared of getting a blood drawn, but there'll be very minimal discomfort. It's just about taking a blood out. And if the antibodies are detected, then further test and treatment specific to the autoimmune condition may be recommended. So this general panel of autoimmune testing will help to identify, okay, any of these autoimmune conditions are causing GI distress. And again, this may be very rare, but when you haven't identified root cause for a long time, maybe we have to rule out this general autoimmune conditions to general panel screening. The next 31st is scleroderma testing. Now, if you have symptoms suggesting scleroderma, such as skin tightening or difficulty in swallowing, so purpose of this test is to detect scleroderma of the intestines causing this motility. So scleroderma can affect the gastrointestinal tract by causing fibrosis and this motility. Even for this, it's a blood test for specific autoantibodies such as anti-centromere and anti-SCL70. Even for this, no preparation is required. A simple blood sample is taken and analyzed for specific autoantibodies, and the presence of autoantibodies indicate scleroderma. And obviously, to rule out, the normal result is no scleroderma-related autoantibody is detected. But if you have these antibodies detected, then further imaging test or endoscopy may be needed to access the external extent of GI involvement. And 32nd, which is third in the autoimmune links to GI issues, let's talk about Raynaud's syndrome and when to get this test. If you have symptoms of Raynaud's syndrome, such as color changes of the finger and toes with respect to in response to cold or stress, that's when you want to talk about Raynaud's syndrome. So the purpose of this test is to identify the systemic issues, including GI symptoms, through clinical examination and possibly nail fold capillaroscopy. And obviously, Raynaud's syndrome can be part of the systemic autoimmune conditions that affect the GI symptoms, and clinical examination and nail fold capillaroscopy to assess the blood flow in small blood vessels. Even for this, no preparation is required. The doctors examines the fingers and toes and may use a microscope to look at the small blood vessels in the nail folds. So abnormalities in the small blood vessels can indicate Raynaud's syndrome. So normal blood flow in small blood vessels, that's what we want. And there is no discomfort at all because it's a non-invasive procedure. And if the Raynaud's syndrome is confirmed, further tests may be needed to access for autoimmune conditions. So autoimmune conditions can also impact the gastrointestinal distress. And if all other tests are done and still not able to pinpoint the root cause, maybe you also want to get tested for autoimmune links to GI issues. And you want to see the rheumatologist for that. And you can discuss that with your gastroenterologist and get the referral. And you may have to advocate for it proactively. If that requires proactive advocacy, please be assertive and ask for it because your health depends on it. Next, let's talk about when to consult neurologist or neurogastroenterologist. You may want to see a neurologist or neurogastroenterologist if you have GI symptoms that suggest a neurological cause, such as dysmotility or neuropathy. For that, we are going to talk about 3 different tests. And number 33 is ACID, autonomic gastrointestinal dysmotility testing. 34, neuropathy examination and the nerve conduction studies. And 35, intestinal neuronal dysplasia diagnosis. So let's start with ACID, autonomic gastrointestinal dysmotility test. So if you have symptoms of dysmotility that suggest autonomic nervous system involvement, then you should go and get this test in consultation with neurologist or neurogastroenterologist. So the purpose of this test is to assess disorders affecting autonomous nervous control of the GI tract, because autonomic gastrointestinal dysmotility involves function of autonomic nerves that control GI motility. So it will contain various tests, including autonomic function test and gastric emptying test. For this, the specific preparation will depend on the individual test, and the test may include heart rate variability, blood pressure monitoring, and gastric emptying studies. And the analysis will be how well the autonomic nervous system is functioning. And if the normal result comes out, which is normal autonomic functions and gastric emptying times, then perhaps we can rule out the neurological reasons. But if the dysmotility is confirmed, treatments like dietary changes and medications may be recommended. And this is just a suggestion, and your gastroenterologist and gastroenterologist and the neurologist may be able to get you the personalized treatment plan. The next, let's talk about neuropathy examination and nerve conduction studies. So when to do this test and examination. So if you have symptoms of neuropathy, which is the symptoms are numbness, tingling, or muscle weakness affecting the GI tract, the purpose of this examination and this study is to detect autonomic and enteric neuropathy impairing bowel motility, because neuropathy can affect the nerves controlling bowel movements, which can lead to motility issues. Therefore, nerve condition studies and electromyography to assess the nerve function will be conducted. For this, no specific preparation is required. The procedure will look like electrodes are placed on the skin to measure the nerve and muscle functions, and the analysis will be done to check for abnormal nerve signals which indicate neuropathy. And obviously, normal results is the normal nerve function. And there will be a mild discomfort from electrode placement and nerve stimulation. And if the abnormal nerve signals are detected, then further tests or treatments like medication and physical therapy may be recommended. And the final test we are going to talk about for neurology is intestinal neuronal dysplasia diagnosis. So if you have severe motility disorders not explained by other tests, so purpose is to diagnose this rare condition affecting intestinal nerves leading to serious or severe motility disorders, because intestinal neural dysplasia involves abnormal development of intestinal nerves. For this, biopsy of the intestinal wall is done to examining the nerve cells. For this preparation, fasting may be required before the procedure, and obviously a biopsy is taken during the endoscopy or surgery. And for analysis, the biopsy is examined under a microscope to identify nerve abnormalities. And normal result is that normal cell development in the intestinal wall, and obviously you'll have to feel a discomfort because it related to biopsy procedure, fasting and preparation, and maybe going to some surgery will involve some discomfort. And if it's confirmed, then further test or treatment like dietary changes and medications may be recommended by your neurologist. And obviously, they can personalize your treatment plan based on biomarkers we talked about, based on how you respond to treatment plans and your physical conditions. With this, we come to the end of when to consult the cardiologist and when to consult the neurologist or gastroenterologist. This way, we can rule out the neuropathy conditions or neurological conditions that causing GI issues. And obviously, after many tests, you have reached to this stage. I mean, maybe a rare conditions is causing GI issues, and to identify that, please consult your gastroenterologist and neurologist. Next, let's talk about when to see an endocrinologist. You may want to see an endocrinologist if you have GI symptoms that might be related to hormonal imbalance or endocrine disorders. So, the test we are going to talk about is called MEN2, which is multiple endocrine neoplasia type 2. So, if you have symptoms suggesting MEN2, such as unexplained constipation along with other systemic symptoms, then this test is run to identify this condition presenting with constipation among other systemic symptoms. So MEN2 is a genetic condition that can affect multiple endocrine glands, leading to various symptoms, including GI issues. And for this, no specific preparation is required. Blood tests and genetic tests are conducted, and the presence of genetic mutations and abnormal hormone levels indicate MEN2. And there is only minimum discomfort because of the blood draw. And if the MEN2 is confirmed, further test and treatment specific to condition may be recommended by your endocrinologist. So again, hormonal imbalances, endocrine disorders could also lead to chronic constipation. And if all the other tests is not able to diagnose, then maybe because of these rare reasons, you may have chronic constipation. So all is useful to discuss with your gastroenterologist and get this test. Next, let's talk about segment 8, miscellaneous test for various conditions and causes. To ensure that we have covered all bases, let's go over some additional tests that might be relevant for specific causes of chronic constipation. And these tests can help diagnose rare and less common causes that may be contributed to chronic constipation. Let's dive in. So here we are going to talk about 7 tests, and we are going to continue our serial number order from our previous segments as well. So number 37 test is blood test for trypanosoma cruzi antibodies. 38, genetic testing. 39, specific allergen test and elimination diet. 40, serum markers and endoscopy bioscopy. 41, autoantibody test and clinical examination. 42, sweat chloride test and genetic testing. And 43, anorectal examination and imaging studies. Let's talk about blood test for trypanosoma cruzi antibodies. You may want to consider the test if you have traveled or lived in areas where Chagas disease is prevalent. The purpose of this test is to diagnose Chagas disease detecting these specific antibodies, because Chagas disease, which is caused by parasite trypanosoma cruzi, can lead to chronic digestive symptoms, including chronic constipation. And a blood test to detect antibodies against trypanosoma cruzi is done. So blood is simply drawn, and the presence of antibodies will indicate exposure to trypanosoma cruzi. And normal result is no antibodies detected, and obviously it has minimum discomfort. And if Chagas disease is confirmed, antiparasitic treatment and monitoring for complications may be recommended. So this is one more additional test you can done if other conditions are ruled out. Let's talk about next testing, which is genetic testing. And genetic testing can be crucial for diagnosing hereditary conditions that might affect the bowel conditions or functions. The purpose of this genetic testing is to identify familial dysautonomia through genetic mutations. Because familial dysautonomia is a genetic disorder that affects the autonomic nervous system, leading to various symptoms, including chronic constipation. For this, a blood test or a saliva sample is taken to analyze DNA for specific genetic mutations. The presence of mutations indicates familial dysautonomia, and normal result would be no genetic mutations detected. Obviously, very minimal discomfort because only blood is drawn, and if genetic mutations are identified, genetic counseling and specific treatments for symptoms may be recommended. Next, number 39 is specific allergen test and elimination diet. And if you suspect a food allergy that might be contributing to your constipation, this approach can be very useful. The purpose is to diagnose cow milk protein allergy by identifying positive allergen test and symptoms involved improvement on elimination. Because food allergies such as cow milk protein allergy can cause gastrointestinal symptoms, including constipation. For this, blood test or skin prick test to identify specific allergens, followed by an elimination diet to confirm the diagnosis. So for this, no specific preparation is required. The procedure involves A, blood test, B, skin prick test, and third, elimination diet. For blood test, a blood sample is taken and analyzed for specific allergens. For a skin prick test, a small amount of allergen is applied to the skin to observe reactions. And for the elimination diet, the suspected allergen is removed from the diet for a period of time to see if the symptoms improve. And the analysis is positive allergen test and symptom improvement on elimination confirm the diagnosis. And obviously, the normal result is no allergic reaction or symptom change with elimination. And obviously, there is mild discomfort from skin pricks or blood draw or elimination diet can be quite challenging. And after this is done, maybe reintroduction of the allergen to confirm the diagnosis and dietary modifications may be recommended. Next, let's talk about serum markers and endoscopic bioscopy. We have also talked about these things in detail above. Here we are talking about this again because for more complex inflammatory conditions, these tests are vital. The purpose of this test is to detect inflammatory bowel disease through elevated inflammatory markers and inflammation on biopsy. Because IBD, including Crohn's disease and ulcerative colitis, can cause chronic gastrointestinal disorders, including chronic constipation. And blood tests to measure inflammatory biomarkers and endoscopy procedures to obtain tissue biopsies. For this, fasting and bowel prep may be required for colonoscopy and endoscopy. For procedure involves blood test and endoscopy. We're talking about endoscopy, with colonoscopy and the upper GI tract endoscopy. So blood tests involve drawing a blood sample to measure markers like C protein, CRP, and erythrocyte sedimentation rate. Both of these are diagnostic biomarker. We talk about in chapter on the role of biomarkers in detecting different gastrointestinal conditions and personalizing the treatment plan based on those directions. We also talk about 7 different biomarkers. And on endoscopy involves inserting a flexible tube with a camera into a GI tract to obtain tissue samples. We talk about that in colonoscopy. So now, if the elevated markers of CRP and ESR are found, then the diagnosis for IBD can be done. And obviously, inflammation on biopsies can also indicate IBD. And obviously, the normal results that we are looking for is normal inflammatory markers and no inflammations on biopsy. This has a discomfort because colonoscopy requires preparation, even upper GI tract endoscopy requires preparation, and blood draw is mild discomfort. And that's confirmed. It can be followed by further imaging tests such as CT scan, and there will be a treatment management if this diagnosis is done. For obviously, we need to confirm it, and for this test, IBD, Crohn's disease, or ulcerative colitis, this endoscopic and biopsy tests are important. Next, let's talk about number 41, antibody test and clinical examinations. We also talked about autoimmune conditions earlier, but we are going to re-talk about this because this is very important. So autoimmune conditions can also impact gastrointestinal health. You already know that. And these tests can help to diagnose them. We also mentioned about scleroderma test through positive antibodies and clinical signs. So scleroderma can cause fibrosis and this motility in the gastrointestinal tract, leading to chronic constipation. So blood tests to detect specific antibodies and thorough clinical examinations can help to diagnose this. Obviously, for the procedure, no preparation is required, and two-step procedure. One is a blood sample is taken to test antibodies like anti-centromere and anti-SCL70, and second is a clinical examination to assess the physical signs of scleroderma. And positive antibodies and clinical signs confirm the diagnosis. So next talk about number 42nd, sweat chloride test and genetic testing. So certain genetic conditions can have gastrointestinal manifestations, and these tests can help diagnose them. So purpose is to diagnose cystic fibrosis by identifying elevated sweat chloride and genetic mutations. Cystic fibrosis detects the exocrine glands, leading to thick mucus production that can cause gastrointestinal blockages and constipation. So a sweat chloride test to measure salt levels in sweat and genetic testing for cystic fibrosis mutations. So no preparation is required. And for a sweat chloride test, a small electrode is used to stimulate sweat production on the skin, and which is then collected and analyzed. For genetic testing, a blood sample or saliva sample is collected for DNA analysis, and elevated sweat chloride levels and specific genetic mutations indicate cystic fibrosis. And if there is normal sweat chloride levels and no genetic mutations, then we can rule out cystic fibrosis that's causing gastrointestinal disorder. So obviously there is minimal discomfort from sweat test and blood draw or saliva collections. And if this is confirmed, the further test and treatment specific to cystic fibrosis may be recommended by your doctors. Now let's talk about the final 43rd, anorectal examinations and imaging studies for structural disorders. We talked about in structural assessment section. Then finally, this is one of the another reasons why we may have chronic constipation. So we are going to conclude this with talking about anorectal examination and imaging studies. Anorectal examinations and imaging studies are essential for diagnosing structural abnormalities that can cause constipation. So purpose is to diagnose anal stenosis or atresia, anteriorly displaced anus, imperforate anus, thrombosed hemorrhoids, intestinal strictures, obstructing tumors, and anal stricture through physical and imaging assessments. Because structural abnormalities in the anorectal area can lead to chronic constipation and other gastrointestinal symptoms. For this, a physical examination and various imaging techniques such as X-rays, MRIs, or CT scans can be conducted. For this, the specific preparation depending on the type of imaging study is required. So two-step procedure. One, physical examinations involves digital rectal exams to check for the abnormalities. And second, imaging studies may include X-rays, MRIs, or CT scans to visualize the anorectal structures. And when analysis is done, it identifies the structural abnormalities that may be causing chronic constipation. And in normal anorectal anatomy with no structural abnormalities is desired, and that will rule out this structural issues causing chronic constipation. And obviously, if this is confirmed, then further tests and treatments like surgery or other interventions may be recommended based on the findings. Obviously, the mild discomforts during the physical examination and imaging procedures. So here in this various test, we want to cover all the grounds so that if your root cause is not identified yet, you can go through this series of tests and discuss with the doctor and get the test done so that you can precisely figure out what's the root cause for your chronic constipation. With this, we have come to the end of our episode. So before I end this episode, let me go to a quick summary of it. So we started with talking about the role of biomarkers, in which we talk about 7 different biomarkers. 1, diagnostic biomarkers. 2, monitoring biomarkers. 3, pharmacodynamic biomarkers. 4, predictive biomarkers. 6, susceptibility and risk biomarkers. And 7, safety biomarkers. After that, we went and talked about at-home test. At-home test, we talk about 15 different tests. Those are, number 1, low fiber diet test. Number 2, poor dietary habit. For simple elimination diet, we talk about hydration test. We talk about dietary log. 5, medication review. 6, physical activity log. 7, temperature test. 8, sensory and reflex test. 9, sensor and mental health assessment. 10, abdominal massage. 11, probiotic supplement trial. 12, squatting position during bowel movements to check for defecation disorders, biofeedback techniques to check for pelvic floor dysfunctions, slow transit time test with markers to detect for slow transit constipation, and home stool blood test for colorectal and potential other IBD or other issues. After that, we talked about the clinical test. In clinical test, we went through 8 different segments. So those segments are segment 1, the initial screening by general practitioner, in which we talk about complete blood count, celiac disease, fecal blood test, dietary and lifestyle history, physical activity assessment, medication review. Second segment, we talk about psychological assessments for chronic constipation. We talk about psychological evaluation and assessment. We talk about behavioral and cognitive assessments. In segment 3, we talk about basic metabolic and endocrine assessment. We talk about thyroid function test, serum potassium levels, serum calcium levels, serum osmolality and urine specific gravity, blood glucose levels, HbA1c, vitamin D intoxication levels, lead blood level test. In segment 4, we talk about gastroenterologist advanced diagnostic test. We talked about comprehensive stool cultures, SIBO, small intestinal bacterial growth breath test. We talk about celiac disease biopsy. In segment 5, we talk about specialized motility and structural assessments such as Sitch marker study, endoscopy procedures, including sigmoidology, upper GI tract, colonoscopy. We talk about CT scan with contrast dye, with rectal biopsy for Hirschsprung disease, full thickness intestinal biopsy. In segment 6, we talk about specific clinical tests for pelvic floor dysfunctions such as anorectal manometry, difficography, electromyography. And segment 7, we talk about exploring complex gastrointestinal disorders beyond standardized tests. We talk about when to consult cardiologist, when to consult rheumatologist, we went to consult neurologist or neurogastroenterologist, went to talk to endocrinologist, and we talk about various other tests. And finally, we talk about miscellaneous because we don't want to rule out any other cases and cover all bases. Tests such as blood tests for trypanosoma, genetic testing, specific allergen test, and elimination diet. We talked about serum markers and endoscopy, bioscopy, antibody test and clinical examinations, sweat chloride test and genetic testing, endorectal examination, and imaging studies. Wow, what an episode! What an episode we had. We talked about everything that we need to learn about biomarkers, home test, and clinical test so that we can control our recovery journey. And talking about taking control of recovery journey, as mentioned earlier in the introduction as well, we are going to include the checklist and user guides to go with this so that you can make this actionable and that you can control the path to recovery and you can control the speed of recovery and you can control your high quality life. I know that it's been a long episode, but after this, I have one specific request. Please subscribe to our channel so that you can take your control back of your recovery so that you can prevent your chronic constipation, so that you can learn how to navigate the healthcare systems. More importantly, how you can live chronic constipation free. Please subscribe and help us reach and grow our channel and reach to more patients who absolutely need this information. Thank you so much and see you in the next episode in which we are going to talk about home remedies for chronic constipation relief. Thank you.